of the Gainesville City Commission. It is April 23rd at 3 o'clock. I want to thank all of you for being with us today. Before we move to adopt the agenda, and I know there's one slight modification that does need to be made to follow our new rules. We need to adjourn no later than 5:50, 10 minutes before 6, because the Charter Review Commission has their public hearing beginning at 6, and we need time to switch over to that meeting. That means that we really need to stop our deliberations and discussions probably by 5:30 to allow time for a public comment on any motion that we might have on the floor. Now we'll play it by ear, and I think we can ask Larry if there are people waiting and get an idea if there's a long queue or not. But anyway, I just wanted to put that out there. So we need to be very efficient with our time today. We've got 3 pretty sizable issues to discuss, and don't want to feel like we're rushed at the end and we can't take action as we need. So with that, actually, let me recognize the clerk, Ms. Gainey. I think you had a suggestion about a modification to our agenda, switching out member comment for direction to charter officers to follow our rules. Can you comment on that, please?
Yes, sir, that is correct. And also one other modification, just a request that you all waive your rules for this meeting, because today's agenda was published at 8:30 versus 5 p.m. in accordance with the supplemental rules. Okay,
thank you. So is anybody willing to make a motion to adopt our agenda with those 2 modifications or those 2 additional items? Commissioner Santos?
So moved.
Okay, Commissioner Ward seconds. So the motion is to adopt our agenda, replacing member comment with direction to charter officers, which will occur at the end of the meeting if time permits, and waiving our rules because of all of the backup not getting in until later in the day than our rules published. Okay, members of the public wish to comment to that motion. Larry?
No, Mayor, I don't believe so. We do have a caller in queue, but it's not related to what you just spoke to.
Okay, very good. So we go to a roll call vote.
Commissioner Warren? All right. Commissioner Ward?
I don't think Warren heard you.
You got it.
Commissioner Ward?
Aye.
Commissioner Ariola?
Aye.
Commissioner Hayes Santos?
Aye.
Commissioner Johnson?
Aye.
Commissioner Simmons?
Aye.
And Mayor Poe?
Aye, that motion passes unanimously. Okay, Madam Clerk, our first order of business.
Our first item is 191156 COVID Equity Toolkit, with the recommendation that the Commission follow the Equity Toolkit model with modifications as necessary.
Okay, thank you very much. And so I'm going to turn it over to our EO Director, Tanisha Marshall, to introduce this item, and then we will move forward with the discussion. Ms. Marshall, welcome.
Thank you. Good evening, Mr. Mayor, members of the City Commission. Tanisha Marshall, Equal Opportunity Director. On our April 16th meeting, the Office of Equal Opportunity was asked to create a racial equity tool that we could vet city programs through. And so I wanted to give this presentation today along with the City Manager, Lee Feldman, so we can jointly show how the equity tool that our office created can vet a city program through. So we'll walk you through GNV on the agenda today to show you how we can vet a program through the equity tool that's been created. So I am going to share my presentation with you. So in previous meetings, we've already kind of gone over what the racial equity tool is. The racial equity tool was designed by GEAR, which is the Government Alliance on Race and Equity. And it's a tool that's been designed to integrate explicit consideration of racial equity in decisions like our policies, our practices, our programs, and even our budgets. And the tool itself is seeking to eliminate racial inequities and advance racial equity, but also it helps us identify clear goals and objectives and have measurable outcomes. And it also engages our community in our decision-making processes. In the tool, we also look at who benefits, but also who's burdened from the programs or policies that we're trying to create. But it also helps to mitigate unintended consequences as well. And also, during the time that we are walking through the steps of the toolkit, it helps develop mechanisms for successful implementation and evaluation of impact. Why this tool is important, it helps us as decision makers minimize racial impacts that we may have to groups in our community. In our organization, I feel it's important for all employees to use some type of racial tool in their decision-making process. It allows for the opportunity to integrate racial equity throughout the city, and it should become a part of regular decision-making processes. Additionally, elected officials should use racial equity tools because it helps set broad priorities and brings consistency between values and practice. A racial equity tool, when it should be used, we should be using this at the beginning of any process that we're about to start. So again, GNV Cares is the topic for today. So with the racial equity tool, we would use the tool in the beginning of the process, such as GNV Cares. So when racial equity isn't addressed until the last minute, the use of the racial equity tool is usually less likely to be fruitful. And so the presentation that you'll see today looks very similar to the steps in GEAR's original toolkit. And the reason why we decided to go with the original tool with slight modifications is because, one, the city has never used this tool before. And I feel like professionally, just using a drastically modified version of the tool could create confusion once we're out of our COVID-19 situation and we're trying to go back to using a regular tool. So this would create consistency, keeping in mind that as I explain it, there will be slight modifications from the tool to help us get through the pandemic. And so at this point, I'm going to start going through the steps of the racial equity tool. And at that time, Mr. Feldman and I, the city manager, will go back and forth to show you how GNV Cares can be vetted through the equity tool that we've put into place. So step number one, in the racial equity tool, we're asking ourselves, what conditions of well-being are you trying to get your neighbors to experience, and what is the outcome you're trying to achieve? Here, the decision maker is having to think about clear objectives and outcomes. And this step in the tool helps encourage clear and desired outcomes. So at this point, Mr. Feldman can explain to you how GNV fits into step one.
Thank you, Ms. Marshall. So when I make these comments, I'm going to make them both on the concept of neighbors and the concept of business. So there may be some duplication between the two. So with regard to, what conditions of well-being are we trying to get our neighbors to experience? Basically, we're trying to help our neighbors survive this crisis and then ultimately to prepare for recovery. As we start looking at businesses, we would add one more piece to that, and that is to rehire or to be able to retain their workforce, the very neighbors that are working for them.
So moving on into step two of the process, typically in times of non-emergency, we would be looking at what data we have to rely on. And if we don't have data around the programs that we are trying to set, we would go out and collect that data. But recognizing that we're in an emergency operations mode right now with COVID-19, we may have to rely on existing data that we've already collected or trends that we're seeing, whether they be local trends or national trends, and rely on that data. And if we don't have those, that is a step that we may have to skip in an emergency situation. So I'll give it back to Mr. Feldman to explain the existing data in step 2.
So as you pointed out, there's not a lot of real data for us to put our hands around because the collection process during COVID-19 is ongoing. But we do have some data that's out there. You can look at unemployment claims numbers and see that we've risen from 2.7 to 2.5 to 3.7% unemployment within our MSA. You can see anecdotal information as you drive the streets and you see which businesses are closed and which ones are open. You can see the anecdotal data of participation in programs like Working Foods and Farm Share as people sign up or deliver for food distribution. And of course, you have your own stories with the neighbors that you interact with. So in this particular case, there's not a lot of data, and we have to rely upon the anecdotal information and the intelligence that we're getting from just talking to individuals, talking at a socially distant fashion.
So moving down to step 3. In this step, we normally ask ourselves, in what ways have we engaged the community on this issue? Now, in times of non-emergency, this is the step that we would have meaningful conversations with the community about whatever program or policy we're trying to put into place and how that program or policy would impact that particular community. Because we are in an emergency situation, how this particular step looks very different. For example, in emergency operations, we may have to rely on past engagements that we've had, or again, look at things like national and local trends, or look at how we engage. If we do have the time to engage community, what that looks like, whether it be through surveys or Zoom meetings. So we would have to modify step 3. And if there is no modification, again, we would have to rely on past engagements that we had or omit this step. So I'll give it back over to Mr. Feldman to talk about step number 3.
So I don't have much more to add to that explanation other than, through processes like this special meeting that the City Commission is having, and the process that we're going to have to go through to reprogram the Community Development Block Grant dollars and the allocation of the CDBG COVID money, which requires some public notice. We've had a meeting with our community partners virtually the other day to hear their input and their needs. And so we will have, public notice of this through the CDBG program. And again, a second special meeting where you'll have a public hearing just on that aspect of GNV Cares on Monday, the 27th at 3:00 p.m.
So step 4, if you look around at different cities and what they're doing, step 4 is one that's in their toolkit that are questions that are heavily relied on in the COVID-19 situation. So in step 4, you're going to ask yourself who will benefit or who or what will be burdened by the decision, because again, we're making decisions on the fly right now with sometimes not a lot of data or not a lot of community engagement. And we're also in this step asking ourselves, how will we mitigate any unintended consequences as a result of these very rapid decisions that we're having to make? So again, step 4 really pushes you to think about consequences such as racial impacts, economic impacts, budget impacts, and how you will mitigate those unintended consequences if there are any.
So this is a particularly difficult one for us to wrap our hands around. The idea here is not to burden anybody ultimately, but to grant some relief. But we are taking funds from different programs and reprioritizing those. So there may be some unintended consequences that are resulting from their reprogramming. In programs like this, and we can have further discussion when the GNV Cares item comes up next, this is where you want to be able to grant the administration as much flexibility in the administration of the program to be able to rapidly address any unintended consequences that we may not have been able to consider in a short period of time. So if things arise, instead of waiting for a future commission meeting, you want to make sure that we have the ability to respond, to adjust, to adapt, and to mitigate the consequences.
In step 4, we're asking ourselves, now that we know what our plan is and who will benefit and who will be burdened, what the unintended consequences are, what is the plan for implementing the particular program? So for instance, you're asking yourselves, is this program or plan, is it realistic? Is it adequately funded? Do you have adequate staff to help implement this program? Is it resourced for successful implementation? Is it accessible? At this point, you are really thinking about how you're going to roll this program out.
So in this particular case, we're bringing in the cavalry. We will reprogram our staff. We will reprioritize this for a quick rollout and quick distribution of funds. We've brought in the assistance of a nationally recognized consultant to help us through the CDBG element, and because of that, a lot of that activity can be duplicated on to the programs that are being funded from the CRA and from the general fund as well. So I think we have enough in resources. We will have a implementation plan. We're interested to hear from the commission. Any particular aspects of implementation you think we need to address so we can make sure that we roll that out in a very short period of time. My intention is to be working forward on this program and make adjustments either based upon today or Monday's conversation, but to have a rapid rollout immediately after Monday's meeting.
So lastly, in step 6, this is asking yourself, how will you ensure accountability and how will you communicate and evaluate results? This is the piece where transparency is really important. We're asking ourselves, how are our impacts be documented? Are we even having an impact with the program that we've implemented? And are you achieving any of your anticipated outcomes? So again, this is the step where we're being transparent about the program and how it has worked or how it has not worked with our community members.
So once the program's done with regard to our neighbors being able to see, hopefully, very few evictions and foreclosures occur within the city would be a measurable objective. I mean, that's the goal here, is to help people survive and to make sure that that they can pay the rent and the mortgage as necessary. Our partners at GRU are helping out already with regard to the ability to defer utility payments and so forth. So this allows us to continue that partnership to make sure that we're keeping people in their homes. With regard to businesses, we're going to be able to look at different metrics like the ability to survive the crisis. Are they reopening? Are they able to rehire and retain the workforce that they had before? Are they prepared ultimately for the long haul in terms of what the recovery is going to be? We're going to be asking those questions of them afterwards. So up front, the program will be designed to rapidly get the information out, and we're going to try to measure those objectives to comply with the HUD compliance requirements at the end after the initial period is over.
So this, again, is GARE's original 6-step model. Again, understanding that in any type of emergency situation that we would have to make modifications to this plan. At a minimum, as we're making decisions on the fly, we should be asking ourselves, what are the racial equity impacts? Who will benefit or who will be burdened? And are there strategies to mitigate any consequences? Because we understand that the model can get quite lengthy, especially when you're talking about collecting data or engaging the community when you're trying to make decisions on the fly. So at a minimum, those questions are ones that should be asked and thought of in your decision-making process. But again, my thought behind, again, presenting the whole model today was because, one, the city has not used this model before. So we would be implementing this very rapidly, and it's very new. However, I did not want to stray so far away from GARE's original model that when we're not in times of COVID-19, that we're having to reteach and retrain a very new model, so to speak, because we've drastically altered GARE's original model. So that is the end of my presentation. I thank the city manager for working with me on this, and I am open to any questions or feedback.
If I can just add to, my experience over the last couple of weeks working with Ms. Marshall on addressing these questions, is they do pose some items for thought on how do you do things, not only from a racial equity mode, but also from just the plain administration of a program. So in my mind, the tool has proven its value, and we're going to look again how we can integrate the tool into more processes as we go forward.
Okay, thank you both. I think it would be helpful if we unshared the screen at this point so I could, there we go. Yeah, okay. And I'm sorry, I'm speaking out loud. I was working with the clerk to try to get the participants reordered so the commissioners were at the top and I could see your hands more easily, but now that has to take care of itself, Omi, so thank you. I can see the full bar now. So we've got 3 people with their hands up, so let's start with Commissioner Simmons.
Thank you, Mayor. My question is to the city manager. You indicated a meeting on Monday the 27th at 3. Can you give us more information about the meeting?
Yes. Yes, ma'am. So that meeting is Monday at 3 o'clock. It is the second special meeting that you said at the April 16th meeting. It is to hear the reprogramming of the community development block grant. We couldn't do that at today's meeting because of the federal notice requirements.
And Mayor, may I have one more question?
Of course.
In the beginning of the presentation, Ms. spoke about the first objective, which was what conditions of well-being are you trying to get your neighbors to experience? And we wanted, from my perspective, that question really wanted to know what are the clear objectives and what are the outcomes. And for the neighbors piece, you said the clear objectives and the outcome was to help the neighbors survive. And I think I would like to hear more detail and just help the neighbors survive. What are our clear objectives and what is the outcome for the neighbors portion of it?
So the biggest threat right now, at least from what we've been hearing, is the ability to pay rent and mortgages. So if we can provide financial assistance in that regard, then we can keep our neighbors from potentially becoming homeless. So when I talk about survival on there, some have experienced unemployment, some are already living at the poverty level. The program will be geared to the extremely low, very low, and low income households within the city.
Thank you, Mayor.
Thank you. And I'm just going to kind of jump in right here before we get to our next commissioner. Just to keep our focus, right now we're specifically talking about the racial equity toolkit and the application of that. Our next item is on the GNV CARES, but Mr. Feldman did present part of the GNV CARES to run it through the equity toolkit lens. And so it's not out of line in any way to ask questions about that, but just to make sure we know we're voting, if we vote on anything here, we will be voting on what the racial equity toolkit looks like and how it applies, and then get into a deeper discussion of the GNV CARES item next. Okay, so up next we have Commissioner Johnson.
Thank you, Mayor. I have some additional thoughts that I'd like to share with you all. I think Omi was able to upload it early this morning. And I'm not going to go through the whole presentation, but I do want to highlight a few things that I think are important within this. So I'm going to start at the end, actually, but you don't have to go there, Omi or Marie, whoever's controlling it. You don't have to. Can everyone see? Okay, my screen looks weird. Hold on one second. Oh, that's not working. Okay, so I'm going to begin at the end, even though you don't have to go there, Marie. And it's really just speaking to us as leadership about how we frame these discussions and make sure that we are embedding equity into all the decisions that we're making. Particularly because I feel like the prioritization of this should be the people that need the help the most. And I think it's going to be important to put some structure and process around how to make sure that this actually happens. So I think that the toolkit that Tanisha presented and Lee, along with her, we're headed in the right direction. Overall, I'm going to be interested in when we use this, how we use it, and how we operationalize it, because I know that it's going to be needing to be done relatively quickly. So during this health and finance, this is an excerpt from the President and CEO of Policy Link. During this health and financial crisis, leaders must commit to a recovery that benefits all people, including people living in or near poverty, and to restructuring our democracy and economy so that it works for everyone. More than 100 million people, most of whom are people of color, have struggled to make ends meet even before this pandemic. Leaders must meet this crisis with the truth about what this nation needs to stabilize, rebuild, and prosper. We must change the rules of the game to reverse toxic inequality, remove the burdens and barriers of structural racism, and rebirth a just and fair nation for all. To realize the promise of equity, just and fair inclusion into a society in which all can participate, prosper, and reach their full potential, leaders must be dedicated to the full set of principles outlined below. This is not a list to follow sequentially or a menu from which to pick and choose. Rather, these principles collectively must guide leaders in developing plans and policies and executing on them to deliver equity results. This guidance emerges from a cross-section of people, the expertise of many organizations in the equity movement, and Policy Link experience in partnering with local residents and leaders to chart a course towards equitable recovery. From this moment, every action, every policy, and every investment must provide significant, sustained support to the people hurting the most and serve as a bridge to creating an equitable economy, an inclusive and compassionate society, and a strong, accountable democracy. And these are the 5 principles. It's center racial equity, put people first, invest in community infrastructure, build an equitable economy, and protect and expand community voice and power. So one thing I wanted to go back to is that the information in the toolkit that Tanisha and Lee came up with works really well. There are a couple of things that need to be said, and that is that it's really important to include staff with a variety of experiences and backgrounds and skills at the decision-making table and include them in the decision-making processes. And it's also important to identify groups and the individuals most likely to be impacted. And to me, it's important that we have this tool ready, available at every meeting where decisions are being made related to COVID-19 and the response to it. There are a few different questions that I'd like to introduce into the framework that I think will be important to consider. And that is 1, what are the racial and economic equity impacts of this decision? 2, is this accessible regardless of ability or status? 3, will this effort help rebuild toward a just, equitable, and sustainable future? And 5, which is Tanisha had in the presentation, are Are there strategies to mitigate any unintended negative consequences of this decision? So I'd like for us to consider that in the framework. I'd also love for us to talk about how and when we're using this. And something else it's really important to mention is that once again, we're still in this stage of kind of normalizing this conversation around race and equity. And it's important to say these words in documents, because I've always said that if it's not written down, it doesn't count. So we need to use the word racial equity. We need to use the words Black, people of color, Latinx, immigrant community. Like, these are the words that we need to use to make this powerful as we move through this process. There are a few other areas that I'm going to skip because I recognize that we don't have a ton of time. But what I also want to mention, and I'm gonna, this is at the end of the presentation, is that it's really important that we still prioritize equity, because I'm gonna read this. If equity is only our priority in times of ease and surplus, then it was never really our priority. And the message then becomes that if there's equity and we're talking about equity, then it's for the people that are experiencing this, and that it's a luxury, and it actually is not. It's something that needs to be prioritized in all times, especially in times of crisis. So I'm going to end there, and I'd love to hear some of the thoughts that you all have. Thank you.
All right, thank you, Commissioner Johnson. Commissioner Warren, I believe you were up next.
Right, thank you very much. Excellent questions and comments there, Gail. What I'm looking at with these 6 steps, and I do realize there is a lot of overlap with the next topic that we're having, so I'm going to try to focus on the 6 steps that Ms. Marshall provided. And I think number 5 is going to be one of the most challenging. But with that focus of what Gail has just brought up, this is an opportunity for us to be able to, that we've already been engaged in trying to figure out what we're going to do for bringing equity to the community that has had the least and has been struggling with jobs, education, and housing. That we're in such a position right now that it's hard to not approach this with like a triage approach, where we're trying to help those who are hurting the most. But if there's some way that we can also recognize that to take care of the individuals getting back on their feet now with the COVID-19 pause basically in our lives, that we look at a way that we can also assist them to get some momentum going, to make some long, big changes in their life, maybe with other skill development for job opportunities that will improve their situation in the long run. So much of that is going to involve developing trust in the community with individuals who have not felt that their government, their community, the businesses have supported them prior to now. And this morning, the COC had a discussion looking at, we're doing our weekly contacts now. And again, I'll save a lot of that to the next item on the agenda. But when I look at some of the data that we would ask, that we look at the data of housing instability. Lee Feldman did mention the data that we have on unemployment, but how do we get some numbers as to what the housing instability is? While the governor did prohibit evictions, that really is covering a field where if the landlord has a loan that's covered by federal funds, it does not provide any requirement of individuals, landlords who have no loans and are a cash clear ownership of their investment properties. So I'm concerned about, not just employment data, but reaching out to the apartment, housing, landlord, property managers to find out what's the housing stability and to help identify individuals that can get back to work. I think that should be one of our data collections that we get also, is the employability out there of individuals who are currently without work but were previously working, and making sure that we can support those businesses where many of these individuals were working, even though they may have been lower income right now, to get people back to those jobs with a sense of income and to give them some sense of hope. The eviction, so concerned about housing stability as it shows up with evictions and people getting forgiveness of their mortgages. The other element, when we want to talk about existing data, I think we need to look at what are the services that are getting a lot of the 211 calls. Talking with some of the people with NAMI in the mental health field, they are just being blasted and overloaded with their staff and volunteers who are able to be available for individuals who are really struggling with mental health issues during this period of time. And we need to make sure that we are supporting them, as that service is such a preventative support needed by so many people right now who don't have their usual contacts and supports for what little social engagement that they had before. And then, of course, to be able to hear back on that step 5, how will we, how is the plan going to be put out? I look forward to hearing more about that. I'll save other comments to the later item when we're going to talk about the Gainesville Cares budget and funds. Thank you very much, Mayor and Commissioners.
Thank you. Commissioner Simmons?
Thank you, Mayor, and thank you, Mayor, for bringing me back to the topic at hand, which is the COVID-19 Equity Toolkit. First, I totally agree with Commissioner Johnson and Commissioner Warren in looking at what's taking place in our community and how we can work together and how we can implement a plan that can benefit all. As I look at the steps, and I want to go back to step number 2, because we are talking about the COVID-19, and this is the equity toolkit. And it says, what existing data do we have to rely on? Also, step 3, in what ways have we engaged the community on this issue? We're having a conversation about hopefully using this framework to address the COVID-19 crisis as a whole. But we have to take into consideration the impact that this disease is impacting, and the persons and the community which is having the most impact by the COVID-19, which is the African American community. And when we look at the data, it clearly shows that the African American community is being the hardest hit with this disease because of underlying issues and because of lack of quality health care. So when I look at this equity toolkit, and as it's being presented, just certain pieces in the presentation, in my opinion, is not really addressing the real issues or the underlying issues that we're facing in this community. So as we move forward, and as we agree to apply this toolkit, because it's entitled the COVID-19 Equity Toolkit, that we really emphasize the disparities in our African American communities and our Hispanic communities, and how this disease is impacting our neighborhoods and our people, the most vulnerable in our community. Now, when we talk about how we engage in the community on this issue, and I'm sticking to this framework and this topic, the COVID-19 topic, how we engage in the community on this issue. That's an excellent question, because we need to be engaging the most vulnerable populations. We need to have conversations with them surrounding the COVID-19 and its effects and its impact in this community. So I would love for us to, once we go to the next topic and we can address certain issues, but if we're going to use a framework that specifically says COVID-19 Equity Toolkit, we need to be honest about what we're facing. we need to be honest about the impact that it's having in our community, and we need to really understand, get a grasp of the reality of what's taking place in our community, especially in our vulnerable neighborhoods, our African American community, and our Hispanic communities. So as we move forward with this, the steps that they're suggesting, Gary's suggesting, that we wholeheartedly apply these steps in the communities that need it the most, the communities that are being heavily hit with this the most, and really work together and trying to come up with some type of solutions and some type of plans. But I think this is a great tool, a great framework, something that we can look at, use the steps to really wrap our head around what's really going on in our communities, and just looking at the steps. Let's do the steps. Let's engage our community. We have the data. Okay, we have the data. So let's use the data. Let's use the tools that we have, and let's work it where our communities are, the issues in our communities are being addressed. Thank you, Mayor.
Thank you. Commissioner Santos.
Thank you, Mr. Mayor. I want to thank Ms. Marshall and Mr. Feldman. I think, and Commissioner Johnson for bringing forward the GARE framework in the first place. I think this is the first time we're actually using it on a major initiative. Using it in emergency time is even more difficult, but I think it's imperative that we do it in this time. There are things going to be missed. I mean, community engagement, it's very difficult to do community engagement right now, and we're going to have to it's not going to be easy. We can't delay things too. We have to be able to make decisions quickly, and we have to be able to iterate. I think that's one of the most important things, is be able to iterate things that are going forward, because people are going to find loopholes. People are going to take advantage of things, and we need to be able to change rapidly to be able to have effective programs that help people who are most in need. Thank you, Mr. Mayor.
Thank you. And Commissioner Johnson, before I come back to you, just a couple observations, I guess. I'm fully supportive of moving forward with this, and getting it wrapped around the COVID-19 response and GNV cares, and so I'm in agreement with all that. I'm kind of looking back and forth, and have been looking back and forth between the steps that Ms. Marshall laid out, and then the additional questions that Commissioner Johnson asked. For a couple of them, there's just complete overlap. They're sort of the same, asking the same thing. A couple of them I feel like are embedded within the six that Ms. Marshall said. So they sort of pull out an element of that, but it's already kind of part of one of those 6 steps that she talked about. And then a couple are kind of new or in addition to anything that Ms. Marshall introduced. And I think the big one that I want to make sure that I think we need to add it somewhere in those original 6 that Ms. Marshall introduced is this accessible regardless of ability or status? I mean, that's the one that really stands out to me. The rest of it, I think, is already embedded in there, and I think we can give a clear direction through a motion that we expect all of these things to be considered as staff applies the racial equity toolkit to the decision-making process in the response specifically to COVID-19. I think for me, I'm ready to approve. I think we're in large agreement here, probably as a commission, and then just make sure that we really include that ability or status as a specific consideration, because I think that one actually gets us at the unintended consequence question, that if somebody's going to be left out, or if there's say a language barrier that's not going to allow us to reach a certain group of our neighbors, that we're going to know that if we ask that question. So anyway, I'm kind of saying the same thing over and over again, and I hate when I do that. So that's my only input. I'll go back to Commissioner Johnson. You're on mute. That's my real job as mayor now, is I just say that. Like, that's my only real function of value. You're still on mute. You're still on mute, Commissioner Johnson. Omi, can we get her?
Okay,
There we
we're there, right? Okay,
Yep.
So yes, I agree with you that we should be adding the is this accessible regardless of ability or status. There's another question that I'd like to add into Ms. Marshall's original framework, and that is this support or relief prioritized for the people and communities who need it the most and are already marginalized? And then in parentheses, lower income, disabled, communities of color, elderly, etc. So if there's no objection to that, I'd like to add that also within the framework. And I also want to get a really good understanding of how staff intends to move forward with implementation of the toolkit.
Okay, let's get through the commissioners.
Okay.
And then we'll ask staff to address that.
Okay, thanks.
Yeah, it's an important point. Commissioner Simmons, if you don't mind if I skip over you, I'll come back. But Commissioner Ward has not had a chance to speak yet, so let me recognize him, then I'll come back to you. Commissioner Ward.
Question for you: are we looking to get around the horn to all of us, and then hear public comment before we ask for a motion?
No, I'm going to do it the same way as last meeting. I think for this, because public comment is so difficult to receive live, I'd rather get a motion on the floor so people calling in know exactly what it is they're speaking to. Okay. It's just going to be cleaner that way.
Okay. Just a couple of comments. First, I appreciate all the effort that has been put in on by Ms. Marshall's office, by Commissioner Johnson, by the manager's office to bring this to us. I think that the use of the toolkit for GNV Cares is not up to staff so much as it is up to us right now as the commission. You know, we have a proposal from the manager's office, and it's our job to ask ourselves those questions and then provide oversight through the process, rather than saying, okay, go evaluate your own process through this toolkit and come back to us again. What we don't want is to get to August before we ever take any action on giving any money out. People are having trouble paying their rent and their utilities and buying groceries right now, and we need to be responsive to that as soon as possible. I would like to see us move forward with this first, with making sure that we apply the toolkit, and then with whatever we accept, I would like us to start getting checks in people's hands by the middle of May, which is 2 months then from the time that we first started asking people to shelter. I want us to be careful. I want us to ask all the right questions, but I also want to make sure that we start putting money in people's hands and not follow the example of other government entities that have talked it to death. I want us to be real careful that in the process we make sure that the money, that the application process is available to people who may not have a computer at home, but there are ways we can do that. We can provide that at City Hall. We can provide it at other city facilities throughout Gainesville. We can be very specific about which facilities and what parts of town we offer those in, but that is a roadblock that I don't want us to get caught by. There are a few other things that I wanted to talk about that really aren't that important, but yeah, I think the responsibility is for us to, my understanding is that we need to decide whether or not to use the toolkit. I think we want to use it. And then when we get to the next agenda item, apply that toolkit to the proposal that's before us. And then the manager will and staff will be able to start putting people through that process once we have the next meeting and all that. I understand we're not entirely finished. So to kind of refocus, let's make sure that the task at hand is whether or not to accept the toolkit, I think. with that in mind, I don't want to step on anybody's toes, but I'm willing to just make a motion that we follow the GARE Equity Toolkit model with the addition of accessibility as part of that.
And I think there was one other question. Is this specifically addressing the most marginalized parts of our community? Correct, Commissioner Johnson?
And I'll accept that as long as we're very specific in the process that it is a response to COVID and not addressing other issues. I want to take care of the most marginalized people first, but it needs to be the most marginalized who have been affected by COVID, as opposed to let's use this crisis to solve everything. I don't want to go down that road, but that's
okay.
That's fine.
Okay, is there a second to that motion?
Second.
Okay, Commissioner Warren seconds. Okay, thank you, Commissioner. Commissioner Simmons.
Okay, I just wanted to go back and ask Commissioner Johnson, what was her comment about adding the additional step? I heard pickup.
So the additional question that I wanted to add to it is this support or relief prioritized for the people and communities who need it the most and are already marginalized? And then there's parentheses, lower income, disabled, communities of color, elderly, etc.
And is that what Commissioner Ward just said?
Yes, Commissioner, as well as the adding the question, is this accessible regardless of ability or status? So both of those were in his motion, in addition to the 6-step process that Ms. Marshall laid out for us.
So, go ahead. No, go ahead.
Yeah, and I appreciate the motion, but I also really did want to get the question answered from Ms. Marshall and Lee, because I feel like that's going to be an important part to potentially add to the motion about what the implementation is. Because I have some thoughts around implementation, and I want to make sure that we're on the same wavelength with that.
Okay, so let's get through the commissioners, and then we'll get to that. I want everyone to keep their good eye on the clock at the bottom of your screen.
Okay,
but Commissioner Spence, you still have the floor.
One last comment. In the motion, which Commissioner Ward, which steps would that be? Because you have 1 through 6, would that be step number 2, or where would that fall in the steps? Or does it matter?
I
don't know that it matters.
It's going to be in the middle. Yeah, I mean, it's
before we're done.
Okay. All right. Thank you.
Yeah, we can let Ms. Marshall figure out where that fits best in the process. Okay, Commissioner Santos.
Thank you, Mr. Mayor. I wanted to ask Ms. Marshall about adding in things and kind of her thoughts on these additions.
Hey, Ms. Marshall. And actually, before we go to Ms. Marshall, Commissioner Johnson, you want to get your questions on the floor as well for Ms. Marshall so she can kind of address all that at once? You're on mute.
That's your job. The questions were around the implementation of this in terms of when it's going to be used, and also about how soon we can get this implemented within the departments. I just don't have any idea about the implementation from the city manager side and Tanisha's side. So I'd love to just hear what their thoughts are around that.
Okay, so I think 2 things. One is, Ms. Marshall, if you'll comment about the 2 suggested additions to the 6 that you laid out, and the second is the operationalization of this toolkit. We understand it's more than just the EO director and the city manager. All 6 charters are going to have to take ownership of their role in this. And so I would just say, if any of them have any questions or concerns before we vote on this, then please bring them up now. Ms. Marshall?
So the implementation of the toolkit, obviously, we would implement it as soon as the commission votes on what it is that they want the toolkit to be. As far as getting this out to the departments, there are models that are already out there that are in the form of toolkit assessment worksheets, where those steps are actually put into a worksheet that would be given to the department with an explanation of what those particular steps are. Obviously, my office would be there in assistance because we realize that there won't be a lot of training done on this before it's implemented. So our office would be there to assist in getting these done. And the suggested additions, a lot of the additions are actually implied in GEAR's model. I did like the addition of, is this accessible regardless of ability or status? I do think that that's a good question that should be added into it. GEAR's model was built on addressing racial equity. So a lot of the additional questions that were in the document provided by Commissioner Johnson, as you said, Mr. Mayor, were already implied. But I do like the addition of the question about accessibility.
Okay, thank you. And I just want to remind members of the public who are listening in and want to comment, the call-in number for public comment is 800-876-7516. Again, that's 800-876-7516. Okay, so we do have a motion on the floor. I don't see any other hands up, including from our charters. Mr. Schooler, let's go ahead and open it up for public comment.
Very well, Mayor. We have Evelyn Fox, who has been standing by and wanted to speak to this item. Ms. Fox, if you can hear us, please go ahead.
Welcome, Ms. Fox.
Okay, my question is, before we actually vote on this, I think it would be very helpful to the public if the motion was restated so that we as listeners can fully understand what the toolkit is.
Yeah, sure thing.
What's covered in the...
Sure, Ms. Fox, I can do that right now. I just want to pull up. I'm kind of split between screens here, so let me. Okay, so the toolkit will include 8 basic questions, sort of 6 plus 2. The first is, so the motion is that our city staff will apply these criteria to how we respond to the COVID-19 crisis. The first is, what conditions of well-being are you trying to get your neighbors to experience? What is the outcome you're trying to achieve? The second is, what existing data do we have to rely on? Third is, what ways have we engaged the community on this issue? Fourth is, who will benefit and who or what will be burdened by this decision? How will you mitigate unintended consequences, if any? Fifth, what is your plan for implementation? Sixth, how will you ensure accountability? How will you communicate and evaluate results? And then in addition to that, the motion added, wrong spot. The motion added 2 more questions. One, is this program accessible regardless of ability or status? And second, who will benefit? Is this support or relief prioritized for people and communities who need it the most and are already marginalized, such as low income, disabled, communities of color, elderly, etc.? That's it.
Oh, okay. Thank you, Mr. Mayor. My concern is, was the community engaged in helping to come up with this, I think you said 8, now it's 10, was the community engaged in any of this, or is this just something that Ms. Marshall and Commissioner Johnson he's bringing it before the full body of commissioners today?
Yeah, so this is the Racial Equity Toolkit was adopted and developed through extensive community engagement, including an event that the EO department had with the public, with some guests that came in and talked about this. And so that was developed over a pretty long process. This specific COVID-19 Equity Toolkit application has been developed between last week's meeting and this week, recognizing that we're in emergency circumstances here and there's an immediate need for relief and support. And we wanted to make sure that we were able to apply an equity lens through whatever relief program that we did. And so this sort of COVID specific portion has been put together by EO through cooperation with the other charter officers. And then Commissioner Johnson shared her contribution to that through an email she sent to the commission this morning.
Okay, thank you. I think I understand what you're saying, but and I do agree that you need to move forward with this and not wait for 4 more meetings, because people are in dire need today. So I hope you all, my only concern was that the community was not engaged, but with the time frame, with everything that's happening, I understand why. But I agree with Commissioner Ward that we need to go ahead and move forward with the toolkit as soon as possible.
All right, thank you so much, Ms. Fox. I'm glad you were able to join us. Mr. Schooler, next caller.
Mayor, we don't have another caller at this time.
Okay, thank you very much. We'll turn back to the commission. Commissioner Johnson.
Thank you. I want to I'm hoping that we're not confusing a couple of things, so I just want to be clear about something. So we are using this racial equity toolkit to analyze any decisions that we make moving forward with any COVID-related decisions, and not just Gainesville Cares. Am I correct about that? Because ultimately what would have happened is that this process with, let's say, VGNV, with Gainesville Cares, this would have gone through this racial equity toolkit process before it got to us, and then we would go through it again. So I'm wanting to make sure that we're all on the same page about when we're using this. We are using it for all equity, for all COVID-related decisions moving forward within the city, within all departments, not just Gainesville Cares. Is that correct?
That I'd make her the motion if you just nod your head in agreement. If you, that's what I heard from the motion.
Okay. Okay.
Yep. Yep. Okay. Commissioner Santos.
Thank you, Mr. Mayor. So to that question, I think we need to have a threshold of all, because all could be, are we putting a sign 2 feet from here or to the left or to the right? And does that need to go through a racial kit? No. So I think there needs to be a threshold, because if we say all, then I think our government will come to a complete stop.
I agree.
There has to be a threshold of not importance, but of, I don't know what the correct term is, but I don't want to use all for a term.
Yeah, okay. I think it's when we're talking about relief efforts, so putting up a snipe sign is not that. We're talking about what comes to the commission for authorization, that definitely applies.
So we're talking about what comes to the commission. I mean, there's things that the manager does that probably should be use this as well that don't come to the commission. I think we need to be clear, because I don't want 2 weeks from now to say, well, this didn't happen and part of the commission or whatever. We need to be clear, I think, with staff. Okay,
I just don't know today on the fly how we set a what that threshold is. Like if it's a number or a, amount of staff hours impacted, or, if you have a suggestion, I'm sure we're all ready to hear it, but.
I just don't think we should say all if we're not ready to say all. We need to have some kind of threshold, and maybe we ask for staff to come back on Monday with something that is a better threshold or something like that. But
that's fine with me. If staff wants to think that over, and then we can make a separate motion that defines what that is. We do have another caller, but I'll go through. Actually, let me get the caller first. I want to make sure we are responsive to our public. So, Larry, can we have our next caller?
You bet. We have Mr. Scott standing by.
Good afternoon. Yes, good afternoon. Can you hear me?
Yes.
Hello? Yes,
we can hear you, Nate.
So, yes, thank you. So I wanted to comment, again, I think the racial equity toolkit is well intended. The obvious concern is that some of the comments made as appended to the motion seem to favor race over others in giving out money. And I would ask that the commission, prior to approving the motion, consult the city attorney to determine whether there's a legal basis for prioritizing people by race or by age, because again, you may be running afoul of discrimination in the effort of trying to do the right thing. So again, some of the language I heard, and I think it might have been you, Mr. Mayor, was, inclusive language, but it seems to be some aspects of the proposal or the motion seem to be prescriptive and restrictive and prioritizing, which I think needs to be discussed with the attorney prior to the adoption of the motion, so that the commission doesn't run afoul of federal law. Thank you.
All right, thank you, Mr. Scott. And yeah, we'll make sure that we don't violate any federal law in what we do here. So we'll let Michelle weigh in if she feels like we're crossing a line. Mr. Schooler, was there any other callers at this time? Okay, back to the commission. Commissioner Ward.
Thank you, Mr. Mayor. Just a couple of things. This is not the first time we've had a discussion about the toolkit. Particularly, those of us who have been serving on the Racial Equity Subcommittee are probably more familiar with it, but we've had larger discussions about it before as well. It's the sort of thing that we ought to be fairly simply embedding in most processes, and something that most of these questions, I think, are things that a lot of city staff, I don't want to speak for everybody, and certainly a lot of commissioners, and again, I don't want to speak for everybody, have been going through mentally anyway. What conditions of well-being are you trying to get your neighbors to experience? What's the outcome you're trying to achieve? What existing data do we have to rely on? In what ways have we engaged the committee on this, the community on this issue? Who will benefit? How will we mitigate unintended consequences? What's the plan for implementation? How will you ensure accountability? And then the other questions, is this open and accessible? Does it prioritize communities that have traditionally had preference in the past, or is it open to communities that have been marginalized in the past and in the present? These are things that ought to be standard questions for us. They're not some foreign thing that we're bringing to the table here. It just, I don't want to use the word institutionalizes, but it memorializes those questions, as opposed to hoping that people would use those questions in the first place. So those are my thoughts on it. Thank you.
All right, thank you, Commissioner Ward.
Commissioner Ward, one coming up. Yeah, I think, again, that we have been working on this, the question of our economic disparity that came up out of the Friendship 7, and this toolkit was already in process to work on making a difference in our community to those most in need. Again, what I think is that this crisis that we're in is really bringing the topic up as we look at who are our neighbors that have been hurt the most. And again, that we know it is often those who are in the lowest economic and lowest ability to take care of themselves that are being affected by this. Do we know, my understanding is we don't know when the money will arrive. Is that correct? Or be available?
Mr. Feldman, do you have a timeline on when, if we approve something today and Monday, when it would become available?
We'd be able to get it in place relatively, next day or two after that. We already have access to the SHIP money. We have access to the existing CDBG money. I believe the line of credit will be there for the CDBG CARES money. And of course, we have the general fund money and CRA money available now.
Okay, that's great. I didn't know if this is, again, a lot of the stuff that we're seeing on the federal level, that the money's not arriving to many of the communities that need it. So if it is available there, then yeah, let's get this moving forward. I do feel that I'd like to see more of the questions answered, though, that have been provided with the 8 questions. And hopefully we'll be able to get more of that next Thursday. But at this point, to be able to understand how we're going to implement it is one of my primary concerns. I don't feel like I've heard how we're going to get this and identify who the people are that would benefit from the Gainesville CARES. So I hope we'll get that answer by next Thursday. Thank you.
Okay, thank you. Just want to check back with Mr. Schooler. Are there any callers waiting to speak? No. Okay. So with that, we will move to a roll call vote to approve the COVID-19 Equity Toolkit framework to nearly all future decisions related to COVID-19.
Commissioner Ariola?
Aye.
Commissioner Johnson?
Aye.
Commissioner Warren?
Aye.
Commissioner Simmons?
Aye.
Commissioner Ward?
Aye.
Commissioner Hayes Santos?
Aye.
And Mayor Poe.
Aye, that motion passes unanimously. Thank you, Ms. Marshall, Mr. Feldman, all the charters, and Commissioner Johnson for your work on this. It puts us, I think, in a much better place as we move forward. So really do appreciate it. Madam Clerk, can you please introduce our next item?
Sure. The next item is 191154, GNV CARES, with the recommendation that the City Commission consider the proposed plan and provide approval for the 9 CDBG allocation resources to the GNV CARES program.
Okay, thank you. Mr. Feldman.
Thank you, Mr. Mayor, members of the commission. I believe you've all had a chance to look at the GNV CARES draft outline that was included in the agenda package. But for just to summarize, what we're trying to do here is GNV CARES is broken down into two baskets. One is GNV CARES about neighbors. The second is GNV CARES about businesses. So
Thank you. I'm sorry to interrupt, but Mayor Pro Tem, you have the gavel for between 30 and 60 seconds. Go ahead, Mr. Feldman.
So GNV CARES about neighbors is an effort to reprogram $696,000 worth of SHIP and CDBG funds that would be designed to give, in our proposal, grants not to exceed $2,500 for the purposes of assisting our neighbors with rent or mortgage and utility payments. This would be geared towards extremely low, very low, low, and then moderate income categories in that priority level. That's consistent with both the SHIP guidelines and the CDBG guidelines. And in your agenda package, we have attached what that is. It's based upon income levels and family size as the criteria. So in that program, we would be looking for to establish income verification, which is a process that our staff is very familiar with as we have administered the SHIP program historically over the last few years. In addition, with regard to the GNV Cares About Neighbors, that would be a program where, GNV Cares About Businesses. That would be a program where we would provide grants of up to $5,000 to businesses that are located within the city and have a current business tax receipt and several other criteria which we have outlined in the memorandum to you. This would be funded through 3 pots of money: general fund, the community development block grant funds, and the Gainesville Community Reinvestment Area Department funds, all equal proportions of $830,000. So these 2 programs, in addition to some other programs that we're already undertaking in our community, are there for the purposes of providing some immediate, instant relief to both our neighbors and our small businesses within the community. Our goal is to, shortly after the meeting on the 27th,
Go right up against 6 o'clock.
Oh, okay.
We have to be done by 6 because there's another meeting.
Oh, okay. Do you want me to?
Mayor, your mic's on.
I'm sorry, the effort would be launched shortly after the April 27th meeting. Very short application period, very extensive outreach program, which we're still developing on that. I'd be interested to hear your suggestions on that today. My goal, and it's an ambitious goal, is to get checks written out. I believe the date is May 11th, which would be the first Monday of the second week of May. So looking at today being the 23rd and getting to next Monday, it would be 2 weeks after next Monday, which is pretty ambitious. But I think with staff working hard, and my staff has pretty much dropped everything that they're working on to work on this program. I think we can get it done, assuming we get the direction we need and we can move ahead. So I've got lots of staff participating today. We have our consultant as well on the line to answer any questions specifically regarding the CDBG program and the process that we will be doing for applicant intake on the business side. And Mayor, you're on mute.
Oh,
I got to say it this time. So.
Yeah. Okay, we have up first Commissioner A. Santos.
Thank you, Mr. Mayor. And thank you, Mr. Manager, and all your staff who've been working on this. I have 3 different things that I would like for us to consider making changes in this. The first one is in the GNV Cares About Neighbors, in that first paragraph there, where it talks about the length of time, 6 months.
Hi, sir. Sorry, this is Larry.
They would the length of time and then also the amount of money. I think we should lower the length of time from the 6 months payments to 2 months. This is an emergency package, and I think we should be focusing on the short term right now, because we don't even know what the next few weeks or months are. And I think if we need to come back, we should come back then. By lowering the months and then also reducing the 2,500 to 1,250, we can help more households. And I think that's the most important thing. And then we can also iterate it off as well. If we feel that it's not enough, then we can come back and put forward another stimulus package. But I think we need to try to hit as many people as possible right now who are in need. The second portion is on the GNV Cares About Business section, where we talk about one of the minimum criteria is loss in revenue due to public health restrictions, i.e. emergency orders. I think we need to clarify this further. I think any business right now could say they have a loss, but I think we should be more restrictive and say that you have to have a 25% or more of a drop in revenue to be eligible, and we should prioritize businesses that have a 50% or more drop in revenue. If there's funds afterwards, we can open it up to more, but I think we need to help the businesses that are being hit the most. And then lastly, I think we should give the city manager some leeway in, I mean, these are the numbers we're going to select, but in terms of the funding sources within these pots, some of them are very restrictive. And I think we should give some leeway to the city manager to move those around as necessary to be able to meet the needs of the programs. And some might have more than others, and then some of the funding sources are much more restricted than others as well. But I would like for us to move forward on this. Hopefully we can get out the money as quickly as possible. Thank you, Mr. Mayor.
Commissioner, before you mute, I didn't catch all of that. So you want to you're suggesting we lower the threshold from 6 to 2 months for the neighbor section. And then what was the second part of that? The monetary?
That we would cut the dollar amount from $2,500 to $1,250, $1,250, so that we can have more families be able to get the money.
Okay.
We have limited amounts of money.
And then for businesses that you wanted a business to show that they had at least a 50% drop in revenue.
I want at least a 25% drop to be eligible, and then a 50% drop or more, they would be a higher kind of.
Oh, they get a
they get more. They get prioritized if they're hit harder.
Gotcha. Okay. Thank you. Commissioner Ariola.
Thank you, Mr. Mayor. Very excited to get into this discussion today. I would like from the outset to start by saying that I think that we ought to give this a vote of confidence today. I would like us to pass this immediately. People keep saying immediate relief, quick relief. Well, that was a month ago. People are already in positions where they are already having to organize rent strikes because they can't afford. So I think any lowering of the time period that this is available and lowering of the funds available to neighbors, I think would work against the program. I have questions and concerns about the various different percentages and criteria for the businesses, but I am not going to pretend to have the magic wand to know whether 10% consideration should be given. I'm not even sure what that means to say 10% consideration should be given. I'm sure it's very formulaic, but I think we need to be very, very cautious about creating a program that has so many boxes and so many hoops to jump through that you're actually going to just discourage people from participating in the first place. And I think that when you say, well, you've got to demonstrate that that your operations have been halted, you've got to demonstrate, this. I think there does need to be criteria for demonstration. But if you're asking for all of this, especially when businesses have been laying people off who would normally do this kind of work, I think you're just going to have people say, well, you know what, it's just not even worth it. I'll just wait for the federal or state government to get it together. This needs to be more accessible and more successful than the state programs that have been floundering in Florida. I do have some questions about the formation of the policy. I think that at this point, I'm prepared to pass it as is with recommendations that I would agree with from commissioners. But I am curious to hear from the city manager why the 3 funding sources were selected. You mentioned that we have some of those funds already on hand so they can be quickly turned around and used. But something that Commissioner Santos just said about giving the manager more leeway to move around money, I actually have concerns with. We're already in an emergency government, and 3 of those general fund items listed as funding sources were commission priorities that have been pushed forward. So my concern is that who is going to be in the room to raise their hand and say, why is this funding pot being chosen over this funding pot, and is just going to be the city manager? I don't think that should be the case. I think there should be, at the very least, a oversight, and it should be the commission. So I would like us to have regular reports. We can have regular reports via email and via memo. That's fine. But whenever we get together, we ought to have discussions as to how the program is proceeding. This is going to be a living program, in my opinion. I don't think it's just let's pass it and we get it out the door. I think this is something that we're going to need to continually be changing, because I disagree about whether we know where we're going to be in the future or not. I think the only reason we don't know that is because we are in a misinformation war right now all around the world. The science has been pretty clear that until we get a vaccine, we are going to have to live with this virus. And so coming up with relief and coming up with ways to establish an economy that can at least supply life's basic needs for the long term is what we're going to have to do. So I think we ought to keep the time periods that have been listed. So I will hold off on making a motion to go ahead and pass this program to hear from my colleagues, but I think that's where I'm at. And I would also like for us to begin having discussions, not just, this is obviously a discussion about Gainesville Cares, but at our next meetings, I think we need to start talking about continuity of government. I've had a number of Zoom meetings with people who are still itching to get their projects going. And the sooner we can get that moving, the quicker we can start to at least restore confidence in the economy. Thank you, Mr. Mayor.
Thank you. Mr. Feldman, did you want to jump in there before I go to Commissioner Ward?
I did. I just wanted to clarify what I understood Commissioner Hayes Santos was saying about the flexibility, not to move money that's not on the sheet already, but to, if we need to move CDBG funds a little bit more to, let's say, the neighbor program, and to take a little bit more or move some general fund to the neighbor piece, but keeping the allocations the same, just giving some flexibility to move it between those buckets. So understanding that we have certain restrictions, but going back to the conversation we had before on unintended consequences, if there are some, and I can adjust our bucket allocations to address it. That was, I believe, the intent of that motion, or that
was my intent, Mr. Mayor.
Okay, thank you. And we I have our city attorney wanting to apparently keep us out of trouble. Ms. Shalley?
Thank you, Mayor. I just wanted to point out, and the city manager can correct me if I'm wrong, but I think that what you all are being asked to do today is to approve the allocation of the funding resources to this program, not the actual program document. In other words, because staff still has to do a little more work on this program document. Obviously, we're trying to make it nimble and flexible. And for example, we don't want to be setting up a sunshine law committee of staff members. So my office has been working with the city manager's staff. And so it will look a little different. I just didn't want the commission approving this actual program document and thereby locking staff in at this point.
Okay, thank you. Commissioner Ward?
I would just only qualify what the city attorney said by saying we are looking for parameters. So if you wanted the buckets to look differently, we need to know that. If you want, let's say, as Commissioner Hayes Santos said, a different funding level for neighbors, we need to know that so the program can be reflective.
Thank you. Commissioner Ward?
I'm sorry, did the manager answer my questions?
What were your questions?
How did the funding pots get decided in the first place from the general fund, and how are you going to decide them going forward?
So the general fund buckets, I went through and looked at past money that has been allocated, that has not been spent, asked the questions why. So for example, there's money for an enterprise zone program. Well, a couple of years ago, the state did away with enterprise zones. You had allocated money for QTI, but we haven't had QTI participation in there. So there's the big chunk of the general fund money was commission chamber renovations. That seemed to be a program that came from my staff to the commission, and quite frankly, nobody could tell me with certainty what that was for, other than it was going to be some upgrades to what the chambers looked like. So these were my recommendations. Electric charging stations, savings that we've had because fuel has gone down in price. So that's where the general fund money came from. The CDBG program, we did an analysis on on where those dollars were being spent, what dollars we had available to reprogram. Staff made the recommendation in regard to that. Bulk of the CDBG money is the new money that's coming through the CARES, the first CARES Act of stimulus that provided entitlement cities, and we're one of them, with funding that's about $806,000. The SHIP money, similarly, we looked at programs where we don't have activity and where we could reprogram that the existing SHIP dollars that we have. And I've got folks from Housing and Community Development and similarly for same type of exercise with the CRA. So they're on here. They could talk more specifics if you need.
Sure. Are we going to have a discussion about how we're determining which CRA funds are being used?
So the two buckets of CRA money was money that was slated for economic development activities in the fiscal year 20, as well as some old money that was for the Midtown policing program, which never got up and running and established, and one that the GCRA advisory board, and I believe the commission concurred, would be discontinued in the future.
Okay, I think we need to be cautious about how much we spend out of the CRA. I think some of the more difficulty things we'll be dealing with in the next year are going to be the loss of revenue. And so some of the projects that we expected there to be money, there may not be. So I don't want us to get ahead of ourselves and start spending money that we don't have yet. Thank you.
Thank you, Commissioner Ward.
Thank you, Mr. Mayor. A few things. I know we're going to have a robust discussion about this over the next hour or so here. Thank you to the manager and the manager's team and everybody who's been involved in putting this document together. I think it's a thoughtful document that is going to do our neighbors some good. And by neighbors, I mean our business owning neighbors as well as people who don't own businesses. So I'm glad that we're moving forward. Let me say at the beginning here that, as I said a little earlier, the priority for me is getting this moving and getting cash in people's hands, checks rather, in people's hands, so that they can get their bills paid. There are a few changes that I would recommend. I would be comfortable with moving ahead with moving the neighbor's timeline to 2 months. I would prefer 3, but I don't want to split hairs. 2 months is acceptable to me, and lowering it to $1,250 per family, I think is a good thing to do as well, so that we can reach more people. The total that we're working with here seems like a lot of money in the short run, but it will go very, very quickly. So I want to be able to help as many people as we can in the process. On the neighbors side of this, I would like to, under criteria, currently it says proof that COVID-19 pandemic caused unemployment or reduction in work hours, which resulted in a reduction of wages, and if unemployed, proof that they have applied for unemployment benefits. I would like to strike the references to from and if unemployed through the end there. I think that might help us lower the barrier to some undocumented folks, as well as just lower the barrier in general. If the unemployment system has been, I haven't obviously applied, but I know a lot of people who have, and all of them have expressed frustration with it. And I don't want that to be a barrier, or the inability to get through that system to be a barrier to getting GNV CARES funds. So I would like to drop reference to the unemployment system on the neighbor side of things. If possible, I would like to, well, that's good. I mean, I'll leave the neighbors at that for now. On the business side, I want to make sure that this is open to specific sorts of nonprofits, not ones that are entirely dependent on gifts and donations, because that's much harder to quantify. And I say that as a nonprofit manager myself. that's a tough thing to do. But primarily arts organizations who are nonprofits who live on ticket sales. That's an easy thing to quantify. If you're a nonprofit that essentially acts as a business, then I want to make sure that you qualify if you meet the other criteria here. Our arts organizations that depend on ticket sales are out of luck. I mean, there's no way we're going to be allowing them to go back to providing shows in the near future. So those are folks that I want to make sure we include in this. Let's see, what else do I want to hit? I have reservations about asking people to show us exactly how much revenue they've lost year to year. I think that creates a barrier that isn't necessarily a barrier. If they've lost revenue, I think that's good enough to get in the queue. And for people watching at home or somewhere else who have not actually seen the document, the criteria for business is business must be located in the city of Gainesville as of March 16th. They must have a loss in revenue due to public health restrictions, emergency orders. They have a maximum of 50 employees, which 50 seems like a lot for some lines of business, but if you're running a restaurant or a bar, it's easy to employ 50 people and still be a very small business. So 50 I'm comfortable with that number. Current business tax receipt from the city of Gainesville, and the business is not filed for bankruptcy protection prior to March 16th. Applications would be reviewed and recommended for award by a 5-member staff committee. And I won't go into who, because that certainly might change. I want the criteria to be judged and evaluated by staff, and I want it to be simple to evaluate. I don't want there to be judgment involved in this. I want it to be, do they meet the criteria? Do they not meet the criteria? The further criteria are operations were halted or curtailed by emergency orders, good faith efforts to provide pay or benefits to furloughed employees and retention of employees should be considered. Local ownership is vital. I don't want to send money out of town on this. And again, the number of employees being below 50. I think that's all I need for now. I think this meets our toolkit. There's just to run through it real fast. The conditions of well-being we're trying to meet are that we're trying to get people who are most affected, and I can tell you who those people are going to be. I mean, that's not going to be outside the realm of our, particularly on the neighbor side. It's not going to be outside the realm of what we're trying to achieve from a racial equity viewpoint. We have some data. We don't have a lot of data yet. We won't have all the data until we look back on this months from now. But if we want to get cash in people's hands, we need to start moving. And what ways have we engaged the community? It's largely anecdotal at this point. I know we have all received calls and emails and personal communications of all sorts from people who are hurting and people who need help now. Who will benefit? The people who are most hurt will benefit. I think the criteria here will make sure of that. Some unintended consequences are that we're not going to be able to do some other things that we would have been able to do with the money. But I think that this rises to the level of moving some of those other things out of the way. We have a plan for implementation. How will we ensure accountability? That goes back to something Commissioner Ariola said. I think it was Commissioner Ariola. I would very much like us to, anytime we have a commission meeting, to have a report from the manager on what the current implementation status is with the details. Certainly email us those things also, but we need a live report anytime we have a meeting on the status of GNV Cares. Again, we need to be absolutely sure that this is available, that there are as few barriers as possible to being able to apply for this. And we need to make sure that we're reaching out to every part of the community we possibly can think of to let people know that it exists. That starts with traditional media sources, both paid and otherwise. And I would ask media sources that are watching this to please help us get the word out so we can help our neighbors in this process. A lot of it is going to be personal word of mouth. We all need to activate our personal networks and let people be aware that this exists. We need to push it hard through the city's social media and through all of our social media to make sure that people are aware. And just working those personal networks. We need to make sure that happens. We need to reach out to groups like the NAACP. I'm glad Ms. Fox was able to engage with us earlier. The 4As, every group that we can think of, the Human Rights Council, all those folks need to be aware how they can help their members and their circles of influence apply for this. I want to say one thing, and then I'll shut up. When I first saw this, I was dubious of having the lion's share of it go to businesses. I want to put as much money as we can in the pockets of our neighbors quickly. I also want to make sure that we make good long-term decisions with this. Keeping our very small businesses in place as much as we can helps our neighbors keep their jobs long-term. And that's critical in all this. If we flush out all the money that we can, and by the way, much of this is from sources that we are not going to be able to put directly in people's pockets, that they'll have to go through other sources, and some of it's geographically curtailed. I want to make sure that our business community, our small business community, our very small businesses get protected in this so they can continue to be able to hire the neighbors that they've been hiring, so they can keep paying people, so that network continues to exist, so that a year from now we don't look back and say, oh my goodness, we have this huge hole for employment where there used to be opportunities for our neighbors. So I want to be very careful about that. Wherever we can, I want to put money directly in the pockets of neighbors, but I want to make sure we maintain the very small business structure. I'm not concerned about Publix. I'm not concerned about very large businesses. They can make it on their own. They should have 60 to 90 days of money socked away somewhere. But very small businesses, I want to make sure that we take good care of them so that they can continue to take good care of our neighbors. I think that's all for now, Mr. Mayor. Thank you for the extended time.
Commissioner Warren.
Mr. Mayor. Sorry.
Oh, I'm sorry. Go ahead, Mr. Feldman.
I just wanted to address one point. Commissioner Ward mentioned non-for-profit organizations. There is some restriction on the CDBG dollars and maybe on the GCRA dollars that would limit that on there. So initially, I would tell you that funding of not-for-profits would probably come from the general fund portion. But there are some federal restrictions with regard to CDBG, and I'd have to get with Ms. Vidal-Finn to look at our CRA plan to make sure it's consistent with that as well. And our consultant is on the phone on here too, so he can correct me if I misspoke on the CDBG piece.
Okay, thanks. And I just want to point out to everyone, we're definitely running up against time here, so let's get to the commissioners, and then if there's any questions for the consultant, we'll get those at the end. Commissioner Simmons. I'm sorry, Warren.
Okay, thank you. A couple of points that I've made notes of, and just following up with the last comment that both Commissioner Ward and City Manager made regarding nonprofits. I'm hoping that you all got a letter from Jane Morawski with the Continuum of Care, and a letter that she had directed to the City Manager and various members of the city staff with the advocating for some funds from the Gainesville Cares to assist those nonprofits who are out in the trenches, keeping people housed or assisting them get back into housing. There's that whole umbrella of housing stability, and many of these nonprofits are being stretched way beyond the workloads that they have done before, and are looking for local assistance to add to their fund budgets and also from the state and federal levels. So I didn't see anything on our Gainesville Cares when we talk about neighbors and businesses that identified that category of nonprofits. Yeah, I see Lee wants to say something.
So just on that point, there's going to be some additional CDBG funds that we have programmed. You'll see it in a footnote that is dedicated to public service agencies. Normally, the funding restriction on that is 15% of our allocation. I'm shooting to use 30% of our allocation for public service agencies. There is a different process that we will go through for awarding money to public service agencies. Candidly, we have not gotten that far in the program at this point.
Did you see the letter that was sent?
I did. So this allocates $160,000 for public service agencies, in addition to some potential dollars we might have to reprogram as well.
That's great. Appreciate that. Because
minimum of 160,000.
Okay, and then I was wondering with what we get with the CARES Gainesville or Gainesville CARES and the SHIP funds. When I look at the first page talking about the funding sources and SHIP funds being mentioned there, I was wondering if that is including some of the Sadowski funds, or if the Sadowski funds are still going to be available for some of the other things that traditionally we hadn't had any Sadowski funds for, or if they're pretty much all being directed into this Corbid assistance.
No, the 2021 allocation is not part of this because we don't know how much money that is yet.
Okay.
So it's all existing SHIP money that we have in our hands right now.
Okay, that's great to hear, because I know there's a lot of optimism about Sadowski coming to the state that agencies haven't been able to touch for too many years. I would like to really, so with that, my last statement about the nonprofits is to make sure that our staff are working with those nonprofits out there to have an accurate sense of what their needs are day to day. Going to the discussion about what Commissioner Hayes Santos started out with, talking about shifting the numbers there a little bit with how we put money out. I would agree that doing 6 months at this time may not be necessary, but I think certainly 3, with the recognition we're already 2 months behind with individuals who have been out of work there. I would like to consider 3, that by the time this money gets out there, the 3rd month rent's going to be due also for many of these families before they get paychecks from any jobs that may be putting them back to work. And the consideration of, I don't see that this $2,500, which several commissioners have suggested we change that amount, but was that going to be for the full 6 months or 3 months, or was that per month? City Manager?
Sorry,
So
just trying to unmute. The original intent was that the $2,500 would be over a 6-month period. You would get a check for $2,500, and then if we have a continuation of the program, you would be able to apply another 6 months for it. Under Commissioner Hayes Santos' proposal, that would drop to $1,250, but have a 2-month period of time. So if we got additional resources, you could reapply for month 3 and 4, month 5 and 6.
And then to that oversight part, each of those cases I would hope would be considered per household need, like someone who's got their rent covered pretty much all by housing choice. Their rent's already being paid, but they need the most assistance toward their utility bills and food. So is there that discretionary element with the application process that identifies where their specific family funds are accountable?
So what we would do, again, because we want to be fast, I mean, this is a big go fast type of program for us, is that we're going to look at your income. We're going to verify it. We're going to put it on that chart. If you're in the extremely low, you're going to get priority. Then we'll go to the very low, and then the low, and then if there are still additional funds left in moderate households. We're not going to, the program's designed to provide housing and utility assistance, but we're giving a check, and we're not going to go back and ask you to give us receipts on how you spent that money.
But one of my concerns is that their rent for $1,000 is for somebody who's paying their full rent and doesn't have a housing choice voucher. It's very difficult for any family to not have rent less than $1,000 a month. And if somebody has a housing choice voucher, they may only be paying $100 a month for their rent because HUD is already paying that other portion. And my concern is that $1,000 per month. So that's where my concern is. $2,000 for 3 months isn't going to cut it for so many of these individuals that are needing assistance. But if there is an opportunity for a motion, I would definitely like to move it from 6 months to, I would like to see 3 months be what we would consider. And if it's for a one-time payment, then I would go with a $2,500 up to, again, that's up to, with the application process that hopefully can identify what portion of rent individuals are paying and what they need for food and utilities, because a lot of those individuals are going to need more to actually pay their utility bill than they will need to pay what their contribution is towards rent. I don't know if that's making sense.
It makes sense. The only thing I would caution you is the more we have to look, more items we have to look at and compare against, the slower the process is going to be.
And that brings me to my last point. I was wanting to get clarification with what Commissioner Ariola was saying about commissioners be involved more in the oversight of that. If Commissioner Ariola is available to clarify that, because otherwise I feel having us involved in that process where there are staff working 5 days a week on this, part of our job as commissioners is to understand and feel that we have staff that we trust to do the work. And I am concerned that if we try to be the ones to oversee that process, we will be encumbered and it would be too much time there. So I do want to advocate for the support that we have a team of individuals that are on staff who can make that assessment, and that we don't need to be overlooking the shoulders of our staff to too much of a depth. I think the regular reports to say how it's being implemented is fine, but we are going to have so many people applying for assistance. We should not be the ones looking at those applications. We should just be giving the policy as to how it proceeds. I'm finished. Thank you very much.
All right, but thank you, Commissioner Simmons.
Okay. Did she want Commissioner Ariola to respond?
I was hoping for Ariola.
I would like to get to all the commissioners before we go to a second round. Commissioner Simmons.
Thank you, Mayor. I wanted to address Commissioner Hayes Santos' recommendation about the cutting back the $1,250 for 2 months, and on the same lines of what Commissioner Warren just stated. Our current rental average rate is what, $900 a month, and if you were to just have access to $1,250, you may pay 1 month's rent and a portion of your utility bill, and that's in itself is okay. But we're trying to really truly help our neighbors. So I don't think that we should decrease the amount nor the month, but I am open to the $2,500 up to 3 months, which Commissioner Warren just suggested. If I'm not mistaken, City Manager we should be receiving additional SHIP funding for that program?
Hopefully, the governor still has to approve the budget. And so this, the Sadowski SHIP money is going to be within that budget approval. He has not, given his veto list yet. And I can't tell you what he's thinking, as, the state's going to be taking a, financial hit as well. But being cautiously optimistic that the trust fund doesn't get swept by the governor. That money would be available shortly after July 1st.
Okay. Okay, so yeah, I do not want to cut the 2,500 to 1,250. I think we need to keep that in place. But however, I will consider up to 3 months, the 2,500 up to 3 months. In looking at the business portion of it, the document states that, let me go to the business portion. This program is designed to assist City of Gainesville small businesses. So my question to the city manager, are we using the City of Gainesville's definition of small businesses, or are we going to use Gainesville CARE's definition of small businesses? Because the City of Gainesville small businesses, I believe we asked for a net worth. And we also, if I'm not mistaken, we use the federal guideline or definition of small businesses. So what guideline are we using to clarify what is indeed a small business? Is it the federal guideline, state, or Gainesville CARE?
It would be the Gainesville CARE. So you would be limited to 50 employees, whereas a typical small business under the federal definition is 200. I think the federal definition has a $5 million revenue figure that's associated with it. There is no local ownership requirement of a small business on there. So what I'm proposing is that we have a more restrictive definition of small business.
Okay, so in addition to that, we're asking our small business owners to provide proof of bankruptcy. Okay, and that's fine. Yeah, so what I would like, that's fine. So go ahead.
No, I was going to say they have to prove that they're not in bankruptcy before March 16th. So if they had filed bankruptcy prior to the mayor's declaration of an emergency, they wouldn't be eligible.
Okay, and so, and then a question I have too is about accessibility. Commissioner Ward hit this home run hit. We have to get this information out to the public. We need to talk to our various organizations. Yeah, you did good, Commissioner Ward. We need to talk to our various organizations, our NAACP, our 4As, our Gainesville Black Professionals, our Hispanic 8 groups, our Latina population. We really need to advertise this and get this message out. So what are we planning on doing for as accessibility and getting this out?
One idea I've had that I have not vetted yet with my staff, so let me just put that caveat on there, is we have 5,288 business tax receipts. I want to look at what it's going to take to mail everybody that has a valid business tax receipt, which is a requirement, basically a flyer on this. I just want to make sure we can get that out in sufficient time. We'll use our social media pieces. We'll work with the business associations that are out there. That's on the business side.
Mm-hmm.
Neighbor side, we're going to rely heavily on our not-for-profit partners, on the radio stations, on the newspaper, on our social media piece. Commissioner, as you know, we're going to try our first door-to-door program this coming week in terms of hitting there. I'm not saying that we can do that, but I want to try to do everything we can to get the word out there with regard to the program, relying on our homeowners associations. We have an existing list of people who've applied for SHIP programs, both current and in the past on there. There are groups like the United Way that are getting requests, and so making sure that everybody knows that this is an available tool so that they can help their clients as well, because their clients are our neighbors. So,
Also,
Mayor, can I interject for just 1 second?
Go ahead, Larry.
Yeah, we've got 4 callers who are standing by to speak, as well as a 5th who we think dropped off. I know you're intending to wait until there's a motion on the floor, but we just wanted to make you aware of the status of speakers on this item.
Yeah, thanks for letting us know. Commissioner Simmons?
okay, thank you. Also, we're going to have a committee. How would the committee be selected, and will it be a diverse committee?
So as the city attorney pointed out, we still need to work on the composition of that on there. But my intent was to have a representative from our housing and community development staff, a representative from our GCRA staff, a representative from it's escaping me right now, our EO partners. And some general fund staff as well. But we just need to make sure that the committee has the proper rules that they're going to function under, and that we're not going to violate any state law, meetings law with regard to that.
Okay, thank you. So what I am concerned about with this document is the funding sources, and the question that was the statement that came up about the flexibility of having the city manager maybe transfer this funds to this fund, or this resource to this resource or sources. I'm not comfortable with that, my commissioners. We have the GCRA funding, which we're taking these, I believe, the small business, the economic development funds from that pot, and the GCRA, of course, is predominantly in the communities that are deemed slum and blight. So I would love for that to stay in place, and I believe legally that couldn't change. I'm concerned about how we're going to look. Let me ask you this, Mr. Manager. The funds, we have the different pots, the CDBG funding, the general fund, and also the CRA, correct?
Yes, ma'am.
Okay, within the general fund portion of it, those who are not in the city, those who live in the city of Gainesville that are not in the CRA district or the CDBG district, which we're using the SHIP model for that, they can't qualify for those certain funds unless, I'm sorry, go ahead.
No, go ahead and finish, Commissioner.
No.
All right, so let me explain. So first let me deal with the GNV Cares business.
Okay.
That's where the general fund is currently putting dollars in the CRA. So the CRA dollars can only be spent within the CRA boundaries. So none of those economic development dollars that are going to be slated for GNV Cares can be spent outside of the CRA boundaries. And the small piece, 200,000, that is for the Midtown policing, or was, can only be spent within the University Heights College Park area. The CDBG dollars can only be spent in those census tracts where there are low to moderate income households. And so those dollars can't be spent outside of those specific census tracts. The general fund dollars can be spent anywhere in the city. And they're the most flexible. An example of a issue in terms of moving dollars from buckets is if we have a issue in the GNV Cares for Neighbors program, which is funded from both SHIP and CDBG, where we're dealing with, let's say, a family that has an undocumented family member in there. The state and the federal government may prohibit us from using SHIP and CDBG dollars. What I'd like the ability to do in that particular case is to take some general fund dollars so we can provide the same type of relief to a family with an undocumented worker, and then replace that general fund money with the CDBG dollars. Again, with so there'd be a little bit more restriction on those dollars in the business program, but ultimately we can meet the needs of our neighbors out there and not be run afoul of any state or federal guidelines, which would cause them to claw back the money from us. So that's the type of flexibility I would be looking for. Again, not changing the bottom line, not changing where the money is coming from, but just how we put it into the different buckets to provide the services.
Right, and that's my concern is the CDBG funding going back into the general fund.
Can't go back into the general fund. It would still have to be used for CDBG eligible areas.
Okay, but I just thought you said that if the neighbors, you needed to put money from the general fund into the neighbors fund, you would replace that with CDBG funding.
So I would keep the $2.5 million worth of GNV business in there, but more money would be in the CDBG pocket, which would then require us to spend it in the CDBG area. I still would have to comply with the CDBG rules. So I'd have a little less citywide money to spend, but I'd still maintain the 2.5 million in the GNV business program. More dollars would be in the CDBG area and less citywide.
Okay, I'm still confused. I just think that I'm just not in agreement with that. And we could talk about that later. But overall, I'm not interested in businesses showing a 50% drop or 25% drop of their business. I think we need to make this accessible. I think we need to get it out to the folks that really need it. I also think that the neighbors care package, we should stay at $25,000 up to 3 months. And that's it for now, Mayor.
Okay, thank you. Commissioner Johnson.
Thank you, Mayor. So I'm going to talk about Gainesville Cares About Neighbors first. I agree with a lot of what you all said. I do believe that there should be more money dedicated to Gainesville Cares About Neighbors. I'm not sure how that would happen in terms of the, pots of money and where that would come from. But overall, I think more money should be dedicated to Gainesville Cares About Neighbors because I'm more interested in the individuals. I would love for us to be able to work with certain organizations to be able to address the needs of some of our undocumented neighbors, rather than it being a direct kind of government to person exchange. You're familiar with some folks out there about HRC, Rural Women's Health Project. There are a couple of other organizations out there that work directly with our undocumented neighbors. 3, I do agree with keeping it at 2,500, and I'd like to see it up to 3 months. The next part I'm going to talk about is the Gainesville Cares About Businesses. And I recognize after all of you talking first that I have a drastically different way of approaching this specific relief program. And I'll tell you that it didn't come from me just like in my head. I really did have conversations with everyone from business owners that, were worth thousands of dollars, very, very small businesses to multi-million-dollar companies in Gainesville. I've probably had about 15 conversations over the past week about this. And here's where I am with it, is that I feel like we're making some really big assumptions when we talk about the business piece of it. One, it's that, I hear Commissioner Ward saying that we want to get money into people's hands, and primarily I'm going to assume that's because we want to sustain them until they can rebuild. If I'm wrong about that, let me know, but that's what I'm feeling the intention is with this. So that's saying that it's quite likely that these businesses will be in business, for 2 to 3 months. And I think that there's just so much information that we don't know right now. We are literally 4 weeks, 5 weeks into the stay-at-home order. I feel like we are like a new economy is emerging. We don't know what that's going to look like. Business owners don't know what it's going to look like for them. And the questions that are being asked are, is it sustainable? Like, is my business going to be sustainable? So whatever decisions we make, I feel like we need to be smart about the money that we're spending. So this is what we don't know. We don't know, one, how long this pandemic is going to last at all. We don't know how, once it does end, and it's not really going to end, there's going to be a certain amount of social distancing that's going to be in place for a while. Consumer confidence has to return, and that's never going to be, that's never going to be something that the governor says, let's open back up, or the city or the county says, let's open back up. It's going to be, do people feel safe enough to go out and attend plays, to go to a concert, to eat at a restaurant next to another table? We don't know that. We don't know. This is kind of a scary thought, but we don't actually know in the fall how many students are going to return. We don't know what the university's plans are for this. We don't know. That alone will change the landscape, the economic landscape of Gainesville drastically. So for me, there are just way too many unknowns right now to feel comfortable about saying, let's give this business $5,000 because we want them to stay around. I desperately want all of our small businesses to stay around. What I feel like would be a better idea is to, at this point, and I wonder if we've asked businesses what they need, because sometimes it's cash, sometimes it's like literally re-envisioning what their business is going to be in 2, 6 months, a year down the road. Perhaps we work with businesses to figure out what is going to make them sustainable in the new economy in Gainesville. And then once we have an understanding what that looks like, my preference would be to save this pot of money literally until fall, 6 months down the road, 6 months down the road, to say, look, here is this money. You have a great plan. Here is the money. And here's the money to restart your business, or here's the money to keep on going. To me, that would be a better use, because what I'm very fearful of, and I'm sure it's just going to happen, it's just natural that it's going to happen, that there are many businesses that are not going to be able to sustain themselves throughout this pandemic, right? So then we have given, I don't know, this is a pot of $2.5 million. We've given money to businesses that might not be around or don't have a plan to be sustainable, when we could be giving money to businesses, one, helping them figure out what their business is going to be and look like in Gainesville, and two, helping to rebuild the economy when we have data. Like, we just simply don't have enough data or information for me to feel comfortable making this decision. So I recognize that is very different from where many of you all are coming from, but that is overall the way that I'm feeling about this. I'm not quite there yet with the Gainesville Cares About businesses. The Gainesville Cares About neighbors, people, they need to pay their rent. They need to have food in their bellies. Like, I get that I'm all down for. And if it really comes down to it, like with Gainesville neighbors, that money, people and their business owner, they can literally just like use that money and loan themselves a certain amount, and then pay that money back to themselves later. So I'm wondering if there could be an element of the individual, because for me, like the small business is a pathway to helping individuals through, employment, right? So let's just go right to this step with the individuals, is what I'm thinking. Those are my thoughts around that. Thank you.
Okay, thank you. I'm going to share some thoughts before I go back around a second time. I want everyone to look at the clock. At 5:30, I would like to take public comment because I'd like to, we need to be off this meeting by 5:50. So just as we go around a second time, if everybody could do their best to just be as brief as possible, and hopefully we can get a motion on the floor before public comment. So first of all, I do support the $1,250 threshold and 2 months, and for a couple of reasons. First of all, if the dollar amount is $2,500, we only get to help 278 families. 278 families. That will be gone on the first day. It'll be gone. Doubling that, helping 550 families is still a drop in the bucket compared to what the need is out there. But I'd rather do that. I'd rather help 550 families rather than 278 families for a shorter period of time. And I'm just, I want us to do the best outreach we possibly can under these circumstances. I don't think it's going to be a problem. I think once it's reported that we have passed in principle this program and staff puts it together, on the first day that applications are due, they are going to get completely filled on the Gainesville neighbors, on the GNV Cares neighbors portion, and that's going to be it. And so I'd rather help more people than fewer people. And I honestly don't think it matters if it's 2 months or 3 months or 6 months, because it's going to be gone. It's just going to be gone. For the business side, I do want to see some accountability there. I'd hate for us to get into the Shake Shack situation. I would say, so I'm not going to name any institutions by names, but I would much prefer that this could get directed towards local homegrown businesses rather than national brands. There can be national chains that have fewer than 50 employees, but they have a support system that a local standalone sole proprietorship here in Gainesville does not have. And so I'm not going to say what that looks like, but that would be my preference. I'm perfectly okay with the city manager having some latitude about how to shift funds to meet the needs as they evolve, and as conditions as we learn more about our conditions. I agree with Commissioner Ward on striking the unemployed part of that, because the unemployed it's so broken that, but when people apply for this, if they still haven't been able to get through, they're going to be cut off from yet another source of relief. And that's the last thing we want to do. I empathize with the funding for the nonprofits, especially the arts institutions. I'm a little weary about including them, although if we can find a way to do it legally, I'm okay with that. I spoke today with Tony Weinberger, who does the fest. And he sent me a letter. I'm going to, sit along to our elected delegation and then also work with National League of Cities and Conference of Mayors from the National Independent Venue Association, basically going over that problem that Commissioner Ward pointed out to us, which is, folks that depend on ticket sales, they know, they sort of put it, his thing was first to close, last to open. They were the first ones that sort of shut down and were really cooperative, and then they're going to be the last to open because, from what Commissioner Johnson said, like just the confidence of people going into a packed auditorium is probably going to freak people out for a while, and so they're going to have a real struggle opening back up. So anyway, the whole point there is there is a very organized national effort to get specific relief for those types of organizations in the next round of funding that Congress is considering. And so I'd kind of like to I don't know if weight's the right word, but I think there's going to be help mean, that's a really strong lobbying group that I think is going to make a lot of sense to hopefully to our elected officials in Washington. And I think relief may be coming. The other reason I want to stick with the 2-month threshold is because there is a pretty optimistic outlook on direct relief funding for local governments in the next round. The National League of Cities fought hard for it this time. wasn't quite able to get there. But I spoke with Eric Godet yesterday with the chamber, and the Florida chamber, and the U.S. chamber is supportive of it in the next round. If they're on board with it, that gives I think a lot of indication about where it's headed. And so my point is, I think that it's more likely that in the next round of funding that Congress passes, there's going to be support that goes directly to local governments that's going to be divvied up based on our normal CDBG allocations. And we're going to, and probably with some added flexibility in how we are able to spend that. And so that will sort of, I think, be coming available to us as this first round closes out. And finally, I don't want this to go to the people that know how to fill out a government form the best. So I do want, Mr. Manager, for you to think about how we can provide technical assistance, whether that's people on our staff that know how to fill out government documents really well and can help, or I spoke with Eric O'Day about this as well. We've got we've got many people in our business community that are really good at this type of work and they're looking for ways to help. And so that the chamber could organize that sort of technical assistance as well. Because there's a lot of folks that, they figured out how to cobble together their business, through trial and error over time, but like applying for a government relief program is not in their wheelhouse. And so we don't want to, when we talk about unintended consequences and who has access and who doesn't, I think that's going to be a big deal, that direct technical assistance in applying for this. So just to summarize, I definitely agree to a smaller dollar amount and a shorter time period so we can help more people. And generally am okay with the other points that Commissioner Ward made and the flexibility to move these funds around as need arises. Going back around the horn a second time, we have approximately 8 minutes. That's about 2 minutes each. Commissioner Santos.
Thank you, Mr. Mayor. One housekeeping thing I'd like for us to have some time for is that we later can waive our rules and then we can move the COVID-19 emergency order and reopening plans to Monday's meeting.
Yeah, absolutely.
And then I'd also like to add one agenda item, the county CRC proposals to that meeting as well, because I've spoken to a few of the people on the CRC in the past 24 hours on the county side, and I think we should have a discussion about kind of some things that are going forward on that. So I've had some time for us to waive rules and do that. I'd like to put a motion on the floor if that's good with you, Mr. Mayor.
Yeah, let's get one out there.
All right. I've moved that we accept the GNV CARES general direction and funding sources. Second, that we change GNV neighbors from 6 months to 2 months and $2,500 to $1,250 to allow more people to access the funds. That we remove the language in the GNV neighbors, the section, and if unemployed, a comma, proof that they have applied for unemployment benefits. 4, we have staff bring back suggestions for adding art nonprofits that rely on ticket sales for the revenue to be added to the GNV business. And 5, just to have I'd like to have some discussion on this, but have staff come back on Monday's meeting with suggestions for further clarifying loss of revenue to make sure that we're helping those businesses who are most in need.
Okay, thank you. Is there a second? There's a second from Commissioner Ward. Marie, if you could work on potentially typing that out while we're getting this additional commission comment, and so by the time you have it, if you can share it, that would be great. Share it on your screen, and that way people at home that are calling in know exactly what the motion is that they'll be speaking towards. Okay, Commissioner Ariola.
Thank you, Mr. Mayor. I after hearing some of the discussion, I'm going to be supporting the motion, although I still have my reservations about some of the changes that the commissioner has made, but we need to get this moving for people right away. As far as oversight, I don't mean for the commission to have direct oversight over applications. That would be nonsense. That would be completely nonsensical. What I mean is that as we move forward with, probably a couple renditions of this program, that we just have a regular discussion about it as the policymakers, especially in our sort of limited government operations. Hearing the commissioner mention just putting off the discussion for the orders, I understand we are up against it, so I will use my last minute to give my thoughts on that. Because the state of Georgia has decided to open, and the discussion right now in the country is centered around leaders making decisions that are completely against what we in our community are talking about. And I think that the public should hear from their leaders what our thoughts are. So for me, before we ease restrictions, I'm looking for 5 prerequisites. We need a sustained and consistent fall in daily transmission rates, infection rates, and death rates. We need confidence that our hospitals can cope with the flow of patients. We need more capacity for testing, more protective equipment, and then a final judgment with the advice of health experts that there would not be a second wave of infections, which I think is one of the black swan issues that people are worried about. So until we have been given confidence in those 5 prerequisites, I will not be supporting easing of any restrictions that we've issued. Thank you.
Thank you, Commissioner. Commissioner Warren.
Motion up there. Okay. Yeah, I'm supportive of the motion, and I recognize being able to, how much money for item number 2 we have, whether it's 6 months, 3 months, isn't going to change the number of people that it helps as much as reducing the amount from 2,500 to 1,250. So I really am supportive of that. And yeah, what I was trying to do is make sure we did talk about the removal of the language of the unemployed, because there are so many people I have talked to who have had difficulty, and even people who are with college degrees that have not been able to get through the system. So I'm glad we were able to remove that. And when we get around to talking about the businesses, just recognizing that so much of what their work is, whatever assistance we give to them now, we still are in limbo, not knowing when they'll be able to start operation. So I think the discussion we've had this afternoon has been really thoughtful and has covered a lot of bases. And to the point that Commissioner Ariola just made, there's enough science out there that should be able to help us in supporting when we get an open Gainesville celebration with still practicing from a distance. So I thank all the commissioners. I thank all the staff for all the work that they've been doing to get us to today. Thank you, Mayor.
Thank you. Anyone else check it out? Commissioner Hayes Santos' tabs at the top. There's nothing embarrassing up there. Don't worry. Commissioner Johnson.
Hey, hi, thanks. Can you, Mr. Manager, answer if when we get this money, if it's allocated from the federal government, this second round, will we be able to reimburse ourselves for some of these funds?
I don't know.
Okay.
First of all, there's no proposal in Congress right now to give us any money. There's been some talk about it on there. They actually just came out with the rules today on the money that they gave cities over 500,000.
Mm-hmm.
So even if there is an allocation that comes out next week, it's going to still be a couple weeks before they even tell us what the rules are. So the answer is maybe.
Okay, thank you. The reason I didn't even this is what I should have said first, is that the reason why I am concerned about the Gainesville Cares About Businesses, it's that if we were flush with cash, then that would be, you know, a different discussion, but we're not, we never have been. And I don't know what it's going to look like in the future, like the financial health of the city as an entity in the near future, and the really, really hard decisions that we're going to have to make. So that is part of the reason why I have some of the reservations about specifically the businesses piece of it. That's it. Thank you.
Okay, thank you. Commissioner Ward.
Thank you, Mr. Mayor. Very briefly, Commissioner Ariola talked about the potential returns, and I know that that's really not what we're considering right now, and I know that's not here, but I did want to put a plug in for a document that I want to discuss when we have this discussion on Monday regarding getting advice and making sure that we have a good source of advice for our to work from, instead of working on, you know, the last news piece that we read, that we engage local professionals who understand public health and can give us good advice. So I would encourage you all to read that document. It was sent out by the clerk's office earlier, so that we can have a good discussion about it on Monday. Thank you.
Thank you, Commissioner Simmons.
Thank you, Mayor. I would like for the maker of the motion to add, or maybe city manager can answer this question, and we can add the answer into the motion. First, the criteria for businesses to receive funding, and I'm not seeing this in anywhere on the draft copy, but making sure that this is a one-time deal. So for instance, if I'm in the mid-college park area, and it's already allocated $200,000, would just be spent in that area. If that's also located under the CDBG SHIP area map, I'm not being able to get both funding. I could get either one or the other.
Oh, no double dipping you're talking about.
Yes,
No double dipping.
Yeah, no.
Yeah.
You could only get one grant from the city.
Okay, so I think we need to stipulate that in this document, because I don't see it anywhere. So my question would be to the maker of the motion to add that into the motion.
Yeah, without objection, Commissioner Santos. Yeah, he's typing it right now. Good catch, Commissioner.
Okay, that's it. Thank you.
Okay, you all did fabulously well. Look at that, it's 5:32. So Larry, let's go ahead and open it up for public comment, please.
Thanks, Mayor. Robin Louie should be our first speaker.
Okay, welcome.
Good afternoon. I hope you can hear me. I really want to thank all of you for the work you've been doing around COVID, and really the work around the equity tool and how to engage our community. I think that my thoughts link into all of the issues that have been discussed today, especially about equitable access. Last night, the North Central Florida Social Service Hispanic Alliance sent each one of you a letter that was produced with the Southern Poverty Law Center, Florida Legal Services, and 40 other organizations to really remind us of the responsibility to abide by Title VI of the 1964 Civil Rights Act, which basically assures that limited English proficient speakers, many who identify as people of color, have access to critical information in their language. And as you know, Gainesville is home to 4,000 foreign students, the majority of them graduate students, who are still here with us because of the crisis. They cannot return home. They spend millions of dollars, and you know what? Some of their families really they're not fluent speakers. This is in addition to a community of immigrants and refugee neighbors who lack English fluency. So though while in the last few years we've really seen efforts to improve language services by the city, as we continue to address this epidemic, we really need to remember that it's critical that everyone is on the same page. You've had town hall meetings, which are bilingual, but they're only as valuable as those who can learn about it. You're placing Spanish messaging at the bottom of announcements in English, which means that Spanish speakers will never find that. We cannot hide information. We need parallel messaging in order to make sure that everyone's informed. Producing Captain Quarantine in English ignores 900 children that are in the ESOL program. So I recognize that this is a crisis. We recognize, as I'm watching today on Facebook, that we're blessed with sign language interpretation, but where is the interpretation in Spanish? We have thousands of non-English speakers. We have got to think about how within the CARES Act that you're looking at, how will they be able to equitably access services? So here at the Alliance, we really request that the city comply with all aspects of the Civil Rights Act, and that we don't make non-English speakers dig for messaging. They will miss out on health assistance and distribution of benefits, which I hear you very clearly all passionate about. So we need parallel posting, English and Spanish. We need to recognize that Google Translate does not comply with the Civil Rights Act. It is not appropriate for life-impacting communication. If you think something is important in English and you're putting it out on social media, believe me, it's equally important in Spanish. So as the community here, as the Alliance, we would really like to hear back from you. What steps will be taken to make sure that we finally comply with language access issues, challenges, which are great, but we're all willing to work together on. And we know you'll send us off to legal, that's fine internally, but we as an international community really want quick action, and we want to see what is going to be done now, especially as it applies to COVID. Please remember that community organizations, the Rural Women's Health Project, the Alliance, the Human Rights Coalition, there are many groups here that are ready to support and assist your efforts in serving non-English speakers with the dissemination of information. But it is the credibility and the responsibility of the city government to make those messages clear to all. So please, we urge you to join us in making sure that we're not only compliant with this act, but that we're also making sure that everyone will get the equitable access that you all have been passionately discussing. Thank you so much.
Thank you. Can we have the next caller, please?
Yeah, we have Nathan Scop standing by.
Welcome.
Yes, good afternoon. To be clear, while everyone can support lending a helping hand to neighbors and businesses affected by COVID-19, the important questions here are whether the city should be repurposing taxpayer money to fund the subsidy program, and two, is expressed by the commission, whether the city is being fiscally irresponsible by undertaking this additional $3.2 million obligation in the wake of having approved significant tax increases and the ongoing budgetary problems facing the city. My concerns are as follows. There should be no sacred budget cows. This commission approved $600,000 plus for an equity budget last year. Not a single penny of this equity money is being used to fund Gainesville Cares. If equity is truly at issue, then the subsidy portion of the $600,000 plus equity budget should be used to directly fund Gainesville Cares. Gainesville Cares about neighbors aid should be also focused on people who haven't been served by existing federal and state programs. There's currently no requirement to check whether applicants have received federal stimulus payment, state unemployment, or whether the employers will pay them via PPP loan, et cetera. The agenda narrative fails to mention about those who qualify may also be eligible for $1,200 federal stimulus check, $275 per week in state unemployment, $600 per week in federal pandemic assistance, and other public benefits, including Social Security benefits, housing benefits, food stamps, et cetera. The $2,500 per person, as mentioned, would only help 278 people. The $1,250 helps a little bit more, but notwithstanding the funding and budget concerns, reducing the amount to $500 would have a far wider impact in helping the community at large. Furthermore, will GRU customers living outside the city who pay a surcharge be eligible for this assistance program? Second or third, public records. All recipients of this aid, you guys better be keeping meticulous public records on this. You're subject to Florida public records law. And then in response to Commissioner Ward's comment, as I stated in my Latchwood Chronicle op-ed, taxpayers, not undocumented persons, should come first if taxpayer money is being expended to fund GNV Care. Transcript of this meeting should be used to seek judicial relief prohibiting the commission from willfully violating state and federal law. You guys are just tone deaf. This is taxpayer money, and you guys want to give it away to undocumented persons. That's inappropriate, commissioners. The $125,000 for a consultant to do in part to create an online app. You guys have hired a plethora of highly paid staff, assistants, and interns. No one there can create a PDF or an online web document to serve this purpose. This is wasting valuable funds that are limited in supply that could be going to helping people, not paying consultants. And finally, the rent strike. There's no legal basis to support a rent strike. Publicly shaming and bullying landlords doesn't help the problem or their willingness to make concessions. I note for the record that Commissioner Hayes Santos is a landlord, as is Commissioner Ward. It's irresponsible for the city commissioners to make support a rent strike from the dais. I mean, that's just not helping the problem. I mean, most people have a 2-month liquidated damages provision in their lease, or they should have taken advantage of that. Again, I'm not sympathetic to the plight, but shaming landlords, that goes against an inclusive community, commissioners. So don't be hypocritical there, and shaming people is not the answer. But I would ask you guys to look at this amount for Gainesville neighbors. 500 per person reaches a lot of people. 1,200 doesn't reach as many. But as you stated, you're going to be out of money from time zero on this one. So you can promote it all you want, but people are going to be angry when they don't get any money that you're communicating broadly that's going to be available. So I just want to make these concerns noted for the record. But there should be no sacred budget cows. Again, you got a $600,000 plus equity budget, and not a single penny of that has been touched to help fund this program. Yet when you raised our taxes, you didn't look at taking any of this newfound money and reallocating it then. You just raised our taxes. So let's look closely and see if equity is at issue. Then let's use some of this equity money to help solve the equity problem. Thank you.
Thank you. Can we have the next speaker, please?
Yeah, Larry Green, standing by.
Good evening. This is Larry Green, Executive Director of the Human Rights Coalition, and I want to thank you for considering and taking into account the many undocumented folks that live in and around our community. These are folks that work jobs, that do pay taxes, many of whom have ITINs, and many of whom contribute locally to our economy in various ways. These folks are in desperate need of your assistance, and they are prohibited by law from accessing funds directly from the federal government. And it's not just the undocumented, it's also folks who are married to U.S. citizens who may not have a Social Security number or an ITIN number. Not only does it affect that individual, it affects their spouse as well. So we at the Human Rights Coalition of Alachua County have already started a campaign to seek donations and have been very successful in seeking donations for this community. And we encourage you to donate a significant portion of this to this community. We're willing to walk alongside you, help you in any way, shape, or form, but these folks need your assistance because they have no voice, no access, and many of whom are unemployed right now. We're trying to create some creative opportunities for these individuals and families to seek employment and at least have some income in the interim, but our resources are limited, and we certainly would appreciate your willingness to come alongside and to support this community as well. Happy to help you and be in touch with you via email. Thanks.
Great, thank you. Next speaker, please.
Next, we should have Max Tipping.
Welcome.
Hi. Hopefully folks can hear me. This is Max Tipping. I'm Policy Director at Community Spring, which is a local grassroots anti-poverty organization. And sorry, I'm watching my son. He might also comment. I'm very excited to see that rent assistance has made it to the top of the agenda here, and I thank everybody for all the work that's gone into pulling together this proposal. Obviously, I also, as the recent founder of the small organization, I think that supporting small businesses and organizations is important, but I think that the balance that you have between these two buckets, the neighbors and the businesses, is pretty far off. Right now, it looks like it's about a fifth for individuals and about 80% for rent for businesses, especially given the conversation that happened earlier today about the equity toolkit. I think that the city, as much as possible, should be trying to provide assistance directly to individuals rather than taking a more indirect approach and going to businesses and hoping that it eventually gets to individuals. With that in mind, I'd advocate for reallocating more dollars to the rent assistance for individuals rather than the rent assistance for business, at least by moving the more flexible funds that you have to get closer to something more like a 50-50 allocation between the two buckets. But ideally, I would say even more towards rent assistance for individuals. I think, we haven't heard it as much now because it's only been 1 month, but I think come next.
Larry, I think we lost the speaker. Ms. Gainey or Mr. Schooler, I'm not hearing anything on audio.
Yeah, Mayor, we can hear you.
Okay.
Yeah, it seems as if Larry has lost his caller. I don't see his line on as the attendee. So if you want to just continue, and I will triage that while you all are deliberating further.
Okay, so we can't hear any of the other members of the public that were waiting right now. It wasn't just that caller; it was Larry's connection.
That's correct.
Okay. Okay, so I see Commissioner Simmons, you have your hand up. Hopefully we'll get our speakers back quickly.
Unmute. Okay. So Mayor, in listening to the callers, Mr. Scott.
The last speaker we have waiting is Elizabeth Ibarola, and I hope I said that right, Elizabeth.
Okay, I'll come back to Commissioner Simmons. Oh. Welcome, Elizabeth.
No, please, go ahead.
Larry, your number that is not in the call anymore, just so you know.
Commissioner Simmons, go ahead.
Yeah, like I was saying, Mr. Scott had a good idea. Have we looked into the equity budget and considered applying some of those funding into the Gainesville Cares? City Manager?
I did not. That money rests with the EO charter, so I only looked at funds that were within my purview.
So before we continue, can we get maybe Ms. Marshall's on the line and see if there is some pot of money in the equity budget that we can apply towards the Gainesville neighbors portion of this?
Yeah, Commissioner, I think we could ask her to come back at our Monday meeting with that information.
I would like for us to look at that and let's have a conversation about it, because I think the more people we can help, the better. And I think that would be a great option. So thank you, Mayor.
Yeah, we'll ask Ms. Marshall to discuss that with us on Monday. Larry, we're still not hearing any callers. Are we cut off?
We do have, Mayor, I apologize. I think we should have Ms. Ibarola back.
Okay, great.
Please go ahead.
We're not hearing any audio.
Can you hear me now?
We can, yes. Thank you.
You should be able to hear it now.
Okay, great. Thank you all very much. So as mentioned, I'm Lizzie Barola. I'm the Director of Immigration Concerns with the Human Rights Coalition of Alachua County. You heard from our Executive Director earlier, and I'm going to echo some of what other callers have mentioned. But I just did want to reiterate that I am so pleased to hear our undocumented neighbors being included in this conversation. We have been working with many different partners throughout the community to ensure that undocumented families have access to food, that they have access to information about those children's schooling, etc. We are reaching out to families individually, calling back multiple times, to make sure, that their needs are being fulfilled. But based on those conversations, we know that it is not enough. So we are not covering all of the regular needs and not even beginning to cover their rent. So, we're working with folks who work in industries which have been particularly hard hit by this pandemic, restaurants and hotels. And as you all know, and was alluded to, these are folks which are not eligible for funds from the Federal CARE Act. This is a group not typically eligible for public funds, which excludes, everyone but qualified, quote unquote, aliens. So many of these people, as Larry Green mentioned, do pay taxes, and I have personally helped some of them to file their taxes in the past. And so on this point, I'm so glad that Commissioners Ward and Johnson mentioned undocumented folks in reference to removing barriers to funds, to outreach, that the city manager has identified the need to draw from certain funding and issuing benefits to undocumented folks. So clearly, y'all are thinking about this part of the community. So my question to you is just, are these funds available to, if Zanesville cares about neighbors, funds available to undocumented immigrants as the program currently exists? If not, what changes need to be made and can be made to ensure that they are? As you mentioned, these funds will go very quickly, and we want to make sure that the most vulnerable in our community do not have additional barriers. As Robin Louie mentioned, public messaging in languages other than English is a huge concern. We can't ask people to be digging for information. Oftentimes, they're looking at this info on phones, not having access to computers. And again, the mayor mentioned that not everyone knows how to fill out government forms. That is certainly true for the folks that we work with. I can tell you from trying to get folks access to free internet programs during this crisis, there are often requirements that are confusing or exclude undocumented people without intention. So have you considered what the actual registration criteria are? How is income verification done? How is proof of employment made? Again, I'm glad that y'all are considering striking that proof of unemployment requirement. But are there restrictions that exclude undocumented immigrants without intending to? For example, will you be asking immigration status? I do have concerns about the particularities of funding, the amount and how long. I know with the folks we work with, help will be needed for 6 months. The industries which they work in will be impacted for at least that amount of time, if not for a full year or more. But again, my primary concern is, are these funds available to undocumented immigrants as the program currently stands? And if not, what changes need to be made and can be made? Again, as our director, Larry Green, said, we are definitely here to help. Please do not hesitate to call on your community partners to help lower these barriers, to make sure that there are not unintended barriers to this help. Thank you very much.
Thank you. Do we have any more callers?
We don't have any more callers, although a caller called a little bit earlier and wanted to ask if the community would have some way to contribute financially to the funds that are being discussed, and she asked that we ask that question during the meeting.
Okay, thank you.
That's all we have.
So we'll put that out if that's possible. We're running up against it here, folks. First of all, we do not ask immigration status. That is not something that the city does. Look, we've got to get to a vote on this, folks, because we also need another motion, which I'm going to have to take public comment on as well, to set our agenda for the meeting next week. So, Commissioner Johnson, is this something critical, or can it wait?
Yeah, I'm gonna mute myself. Can you just split the motion, please, between businesses and neighbors?
Sure. So we're going to have two votes. The first vote will be to vote on the draft proposal for GNV Cares About Business. Madam Clerk, could you call a roll call vote?
Absolutely. Commissioner Hayes Santos.
Aye.
Commissioner Ward.
Aye.
Commissioner Warren.
Aye.
Commissioner Simmons. Aye. Commissioner Johnson. Commissioner Johnson. Commissioner Johnson.
Can you hear me?
Yes.
Okay. No.
Commissioner Ariola. Commissioner Ariola.
I said aye.
Okay. And Mayor Poe.
Aye. That motion passes 6-1. Johnson in dissent. The next vote will be for the rest of the motion. Madam Clerk, roll call vote.
Commissioner Simmons.
Aye.
Commissioner Ward.
Aye.
Commissioner Warren.
Aye.
Commissioner Ariola.
Aye.
Commissioner Johnson.
Aye.
Commissioner Hayes Santos.
Aye.
And Mayor Poe.
All right, that motion passes unanimously. Commissioner Hayes Santos, I'll recognize you for a motion. Sorry, Raul.
Thank you, Mr. Mayor. I would like to move that we waive our rules and that we add 2 items to the agenda for Monday, the COVID-19 emergency orders and reopening plans, and that we also discuss the county CRC proposals.
Okay, there's a second by Commissioner Ward. I'm going to take public comment first, and then I'll go back to commissioners if there's time. Any members of the public, Larry? No? Okay.
No, Mayor, there's none.
Thank you. Commissioner Johnson?
Huh? Oh, sorry. What?
Your hand's up?
Nope.
Old hand? Okay. Commissioner Simmons?
Yeah, thank you, Mayor. If the maker of the motion can add that Tanisha Marshall, Equal Opportunity Director, come back with the equity budget funding and just have a conversation about that, if monies could be allocated from that funding to GNV neighbors.
That'll be included, yeah.
Okay, thank you.
Okay, a roll call vote, Madam Clerk.
Commissioner Warren.
Aye.
Commissioner Ward.
Aye.
Commissioner Ariola.
Aye.
Commissioner Hayes Santos.
Aye.
Commissioner Johnson.
Aye.
Commissioner Simmons.
Aye.
And Mayor Poe.
All right, that motion passes unanimously. Raul, so sorry that we went over. Members of the public, thank you for joining us for this meeting. We will update you as we have new information. Come back to the city's website, social media for the latest. This meeting is adjourned.